Hey everybody, today we will tackle 75 mental health NCLEX RN questions for you to practice. So make sure that you take notes on rationals and task taking strategies. So let's get started with the first part of the three sections. We have test item number 1. A client with schizophrenia is admitted after becoming aggressive, throwing a chair at another client, and refusing medication for 6 weeks. The client shows a flat affect, poor hygiene, and social withdrawal. The provider prescribes Risperidol to address both positive and negative symptoms of schizophrenia. How will the nurse assess improvement in the client's negative symptoms? Option A, reduce hostility, altered thinking, and incoherent speech. B, decreased aggression, strange behavior, and perceptual disturbances. C, improvement in apathy, emotional expression, and social engagement. D, reduction in agitation, delusions, and hallucinations. The answer here is letter C. So when you are determining the effectiveness of Risperidol, you should expect improvement in the client's negative symptoms of apathy, flat affect, and social withdrawal. So options letters A, B, and D are all incorrect. Now let's have letter A this time. And so hostility, ideas of reference, and tangential speech are considered positive symptoms, which Risperidol primarily targets for improvement. We have letter B, which includes decreased aggression. We have bizarre behavior and illusions. These are positive symptoms of schizophrenia. These are not negative ones. Now, letter D, reduction in agitation, delusions, and hallucinations. These are also positive symptoms that Risperidol is designed to help address, but are not negative symptoms. So for you to correctly answer this question, I want you to recognize first what these negative and positive symptoms. And so again, the negative symptoms include apathy, social withdrawal. These are typically less responsive to medication than positive symptoms. And these positive symptoms include hallucinations and delusions. So in order for you to get this correctly, you have to differentiate first between positive and negative symptoms. Number 2, a nurse is contributing to the creation of guidelines to address the rising incidence of suicide attempts in the community. Which of the following measures should be included as a primary prevention strategy? Select all that apply. Option A, providing suicide awareness, education to high school students. B, establishing a support network for relatives of individuals who died by suicide. C, training middle school teachers to recognize early signs of suicidal behavior. And D, implementing suicide risk assessments for all newly admitted clients. E, assigning continuous supervision to a client with active suicidal thoughts. Now, this question is asking you for primary prevention strategies for suicide attempts. And remember that primary prevention focuses on education, awareness, and screenings to prevent problems before they start. And so the correct answers we have are the following. We have letters A, C, and D. And why letter A? Because this is all about prevention at the earliest stage and educating people so they're aware of suicide risk before a crisis happens. So that makes it a primary prevention strategy. The same thing with letter C, because training teachers to recognize warning signs is a great way to step in before things escalate. And since it helps prevent suicidal behavior before it starts, it also falls under primary prevention. Letter D is also correct. We have here screening new clients for suicide risks can actually help catch warning signs early before an attempt happens, which fits the definition of primary prevention. Now, we have the incorrect options here. We have letters B and E. For letter B, establishing a support network for relatives of individuals who died by suicide. This focuses on helping those affected by suicide rather than preventing it from happening. So that means it's actually tertiary prevention, not primary. Letter E is also incorrect because this approach is aimed at people who are already at risk. So it's more about managing the situation rather than stopping it before it begins. So that places it under secondary prevention instead. Now, for you to correctly answer this question, I want you to look for clues such as screening. Okay, so you can find these words in the question stem and also in the options. Look for words such as education, prevention. Okay, so these things that relate to primary prevention. Now, for tertiary interventions, this is about post-crisis management, and the secondary interventions involve actions for individuals at risk rather than preventing the issue altogether. Question number 3.
If you're looking for a full, structured study plan that guarantees success, then this is just the beginning. You can enroll in our full-length NCLEX crash course. For the past 3 years, more than 10,000 students have successfully passed the NCLEX using this program. This isn't just another review course. It's built from real insights gathered from 5,000 registered nurses who have passed the NCLEX. We know exactly what it takes to succeed, and we've designed this course to give you everything you need to pass on your first attempt. Here's what you'll get inside. 300 plus hours of recorded video lectures covering all essential NCLEX topics in detail. 100 plus animated crash course lessons, making even complex topics easy to understand. 500 next-generation NCLEX NGN questions so you can master the new exam format. 10,000 previously asked NCLEX practice questions, reinforcing your learning with real exam-level difficulty. 30 full-length practice tests, helping you develop strong test-taking strategies. A comprehensive NCLEX ebook for in-depth review and quick reference. 1 year unlimited access, so you can study at your own pace without stress. This is your chance. Enrollment is open for a short time, and right now you can get in for 70% off. Enroll now and take control of your NCLEX prep. Visit website www.stancoastnclexcoaching.com. Link also in the description box. Now, let's dive into today's session and get started.
A nurse is monitoring a client taking antipsychotic medication for potential extrapyramidal symptoms. Which findings are characteristic of pseudoparkinsonism? Select all that apply. Options: A. Muscle stiffness. B. Involuntary shaking. C. Pupil dilation. D. Sensitivity to light. E. Slowed movement. So let's talk about what's happening here. So pseudoparkinsonism is basically the body acting like it has Parkinson's disease, but it's actually a side effect of antipsychotic medications or adverse effect of antipsychotic medications. So this happens because these drugs block the dopamine in the brain, and we know dopamine is crucial for smooth movement. So what you're going to see in this patient, they're going to end up with muscle stiffness, which is in option A. We also have involuntary shaking, which is in option B. And there's also slowed movement that you can find in option E. So these are things that you will see in extrapyramidal symptoms. Now, why not letters C and D? Pupil dilation or sensitivity to light in option D. These sound more like anticholinergic side effects, not extrapyramidal symptoms. And take note that the medications that will be used, the antipsychotics, can have anticholinergic effects, but those aren't what define pseudoparkinsonism. And so for you to correctly answer this question, you have to think about the EPS. Think about how dopamine plays a role in movement. And if the symptom sounded like Parkinson's, they're likely EPS. And if the options will probably narrate maybe dry mouth, blurry vision, or trouble avoiding, these are anticholinergic effects. So this will help you eliminate those other options. Number 4, while conversing with a client diagnosed with schizophrenia, the nurse notices that the client suddenly stops responding and begins staring at the ceiling while speaking aloud. What is the best response by the nurse? A, proceed with the conversation without acknowledging the behavior. B, ask, are you noticing something unusual on the ceiling? C, pause the discussion and continue it later when the client is more attentive. D, say, it looks like you're seeing something on the ceiling. I see it too. Now, when you're talking to a client with schizophrenia and you notice them suddenly stop responding, or let's say staring at the ceiling and speaking aloud, it's important to address what's happening right away. So this is how you're going to approach this. So the option here should be letter B. Okay. So this is a direct but non-judgmental way to acknowledge what's happening. And your client might be experiencing a visual hallucination. And when you're asking about this type of question, you're validating their experience, but without reinforcing or supporting the psychotic symptom. And here you're also showing empathy while keeping the situation safe by understanding what the client is experiencing. Now, what about the other options here, A, C, and D? Letter A. This is actually ignoring the behavior, and continuing the conversation can be a missed opportunity to understand what's happening. And if you don't address the hallucination, it might leave the client feeling invalidated or misunderstood. And you won't know if they're at risk or need something more, like further intervention or maybe other safety precautions that you're supposed to do. Letter C is also incorrect, because stopping the interview and trying again later might seem like a good idea, but it's actually better to deal with the issue right then and there. And the hallucinations are a core symptom of schizophrenia. So when you're ignoring them or delaying the intervention, this could allow the symptoms to escalate or leave you without any key information about what the client needs. Now, letter D is also incorrect, because when you're agreeing with the hallucination by saying, yeah, I see something there too, is definitely something you want to avoid. And this can also reinforce the psychotic thought and make the client feel that their hallucination is real. So instead, you want to help them stay grounded in reality without giving into the delusion. So I want you to remember that clients with schizophrenia often experience hallucinations, and you should address these directly to assess the situation and ensure their safety rather than ignoring or reinforcing them. And so asking about the hallucination provides you an opportunity to assess the client's needs and also to ensure appropriate action is taken. Now, you definitely need to avoid actions that reinforce psychotic thinking or ignoring the client's immediate needs. So make sure that you're engaging with the client even in the presence of hallucinations. Okay, this is very critical for their safety. Number 5, a charge nurse is educating a newly licensed nurse about transcranial magnetic stimulation, or TMS. Which of the following statements by the new nurse indicates a correct understanding of the information? Options: A, after TMS, I will provide post-anesthesia care to the client. B, TMS is an appropriate treatment for individuals with schizophrenia spectrum disorders. C, clients typically receive TMS sessions 3 to 5 times per week for several weeks. D, each TMS session lasts between 5 and 10 minutes. So here's the key clue. We have the words 3 to 5 times per week. So that's how transcranial magnetic stimulation is typically done. So it's not a one-time treatment. That is why that is the correct answer. So it actually requires multiple sessions per week over several weeks to be effective. And frequent sessions in the beginning will be done to get the best results. Then there's a possibility that it will be tapered off later. And so this approach helps to maximize the therapeutic effects, and it will ensure the treatment works as intended. Now, if you see that a schedule in a question, you know that you're on the right direction. Now, what about letters A, B, and D? These are all incorrect options. So why letter A? Because this is incorrect, because post-anesthesia care is not needed for TMS. And TMS is a non-invasive outpatient procedure, so the client stays fully awake the whole time, so there's no sedation required. B is also incorrect because TMS is mainly used for major depressive disorder, especially when medications have not worked. And so if we're talking about schizophrenia spectrum disorders, that's where electroconvulsive therapy, that's the ECT, okay? So this ECT is recommended for that, not TMS. What about letter D? This is also incorrect. Each TMS session lasts between 5 and 10 minutes. So the correct rationale here is that a TMS session lasts around 30 to 40 minutes, not just 5 to 10 minutes. So the process involves delivering magnetic pulses to the specific areas of the brain, and it takes time to ensure the treatment is effective. Number 6, a nurse is creating an educational plan for a client with bipolar disorder who has been prescribed carbamazepine. Which of the following instructions should the nurse include in the plan? Options: A, contact your provider if a rash appears. B, you need routine blood tests to monitor your complete blood count and carbamazepine levels. C, avoid driving during initial days of starting this medication. D, avoid consuming grapefruit juice while taking this medication. E, this medication is safe to take while pregnant. So the key clues in the question stem, we have here words: a nurse is creating an educational plan. So this is telling you that the focus is on client teaching. So look for answers that explain important safety precautions, monitoring, and side effects rather than complex pharmacokinetics or provider responsibilities. Now, another clue here, we have for a client with bipolar disorder who has been prescribed carbamazepine. And I want you to recall about carbamazepine that this is a mood stabilizer, also classified as an anticonvulsant. So think about common side effects, drug interactions, and necessary lab monitoring. And we have the last clues here. Which of the following instructions should the nurse include in the plan? So this means the correct answer should be nurses-led teaching points, not medical decisions like adjusting doses or prescribing alternatives. So the correct answers here are letters A, B, C, and D. Why letter A? It's because carbamazepine can cause a really severe skin reaction. We call that a Stevens-Johnson syndrome, which can be life-threatening. And so if a rash develops, it's super important to notify the healthcare provider immediately to prevent complications. Letter B is also correct because you're going to need to teach the client to have their blood tests monitored, such as the complete blood count, and also to make sure that the blood levels of the carbamazepine is also monitored. Because one of the major adverse effects of the carbamazepine is bone marrow suppression, which can lead to a low white blood cell count. And the regular tests are essential to keep an eye on this and make sure the medication is at the right level to be effective, but not toxic. Letter C is also incorrect because the carbamazepine can make the patient drowsy or dizzy at first. So it's a good idea to avoid driving or doing anything that requires full alertness until they see how their body reacts. Letter D is also a correct option because grapefruit juice can mess with how the body processes the carbamazepine, and this can potentially lead to dangerously high levels of carbamazepine in the bloodstream. So they need to avoid taking grapefruit and its juice while they take this medication. Now, why letter A or letter we have letter E as an incorrect option. This means this medication is safe to take while pregnant. Actually, this medication is unsafe during pregnancy because it can cause birth defects. So you need to discuss this to your patient if they're planning on having to have pregnancy. And so make sure that they're going to discuss this with their healthcare provider before starting this medication. So for you to correctly answer this question, I want you to prioritize patient safety. So you need to look for key teaching points about the adverse effects, the monitoring, and also the precautions. So think about the rash, the blood test, the drowsiness, and drug interaction. So also think of eliminating the incorrect options. Of course, this includes the teratogenic effects of the medication. So that's why you need to eliminate letter E this time. Okay, so this is a statement that is misleading. It's claiming that the medication is unsafe. So you need to remember about its teratogenic effect. Number 7.
If you're looking for a full, structured study plan that guarantees success, then this is just the beginning. You can enroll in our full-length NCLEX crash course. For the past 3 years, more than 10,000 students have successfully passed the NCLEX using this program. This isn't just another review course. It's built from real insights gathered from 5,000 registered nurses who have passed the NCLEX. We know exactly what it takes to succeed, and we've designed this course to give you everything you need to pass on your first attempt. Here's what you'll get inside. 300 plus hours of recorded video lectures covering all essential NCLEX topics in detail. 100 plus animated crash course lessons, making even complex topics easy to understand. 500 next generation NCLEX NGN questions so you can master the new exam format. 10,000 previously asked NCLEX practice questions, reinforcing your learning with real exam-level difficulty. 30 full-length practice tests, helping you develop strong test-taking strategies. A comprehensive NCLEX ebook for in-depth review and quick reference. 1 year unlimited access, so you can study at your own pace without stress. This is your chance. Enrollment is open for a short time, and right now you can get in for 70% off. Enroll now and take control of your NCLEX prep. Visit website www.stancoastnclexcoaching.com. Link also in the description box. Now, let's dive into today's session and get started.
A nurse is assessing a client who has recently started taking haloperidol. Which of the following signs should be reported to the healthcare provider immediately? Options: A, difficulty with sexual function, B, unsteady walking, C, severe neck muscle contractions, D, excessive drowsiness. The answer here is letter C. This is actually a sign of acute dystonia, which is a serious adverse effect of haloperidol, and this is an emergency because it can affect the muscles involved in breathing. And so if you observe this, you need to get help right away to prevent further complications. We have options A, B, and D is incorrect. And letter A specifically, the sexual dysfunction here is the adverse effect of haloperidol that can alter the client's self-perception. But This is not the priority finding in this case. We have letter B, shuffling or unsteady walking. This is an indication of Parkinsonism, which can increase the risk of falls, but it's not gonna be as higher in priority compared to our option in letter C. The same thing with letter D, excessive drowsiness. This is a common side effect of haloperidol, which can also increase the risk for injury. However, we're going to have to prioritize letter C this time. Okay. Now, I want you to go back into the question stem here. The statement here said, who has recently started taking haloperidol. So this suggests early adverse effects may be present. And so I want you to take notice about the extrapyramidal symptoms. And this includes the acute dystonia, which can occur soon after starting the antipsychotics. And the next phrase here, which of the following signs should be reported to the healthcare provider immediately? Those words alone is a big clue. So when it says immediately, this signals you that you must prioritize the most urgent, life-threatening complication rather than the general side effects, right? And also, I want you to recall about the haloperidol, that this is a high-potency first-generation antipsychotic that that is going to place higher risk of EPS. So we have the dystonia, Parkinsonism. There's also akathisia or possibly tardive dyskinesia. Now, I want you to recall about severe neck muscle contractions in letter C. This is suggesting acute dystonia, which can progress to laryngeal spasms and airway obstruction. So this is definitely going to take priority. Think about airway compromise in this option. So you need to focus about the urgency. All right. And you need to quickly identify letter C as the highest priority among the options. We have question number 8. A nurse is conducting an admission assessment for a client with a delirium caused by an acute urinary tract infection. Which symptoms should the nurse anticipate? Select all that apply. Option A, awareness and alertness remain unchanged. B, relatives report noticeable shifts in personality. C, increased agitation and restlessness. D, gradual decline in memory over time. And E, sensory disturbances such as hallucinations. Now, let's talk about the symptoms of delirium, especially when it's caused by something like a urinary tract infection. So when you're caring for somebody with a delirium, you'll see a few things that you should definitely keep an eye out. And so the correct answers here are letters B, C, and E. Why letter B? Okay. So when someone develops delirium, their behavior and personality can change pretty quickly. And family members who know the person will often be the first to notice these changes. And so they might describe the person as acting differently, and maybe they're more confused, agitated, or simply not themselves. So unlike dementia, where changes happen slowly over time, but here in delirium, there's going to be a sudden and noticeable change. Letter C is also one of the correct options here, because a lot of people with delirium get really restless and agitated. So it's like they can't settle down, and it's often linked to confusion and abrupt disorientation. So they might have trouble staying still. They feel so anxious, and they exhibit a lot of physical activity. And this can be especially troubling because their behavior can change pretty quickly. Now we have letter E, hallucinations. And one of the more alarming things about delirium is hallucinations. And so people with this condition, they're gonna hear or they might see things that aren't really there. So it's pretty common in cases of delirium, especially when they will have the urinary tract infections. And so this perceptual disturbances make the person even more confused and anxious. Now, what's not typically seen in delirium? So we have options letter A and letter D. Now, why letter A is incorrect? Because in delirium, the level of consciousness isn't always steady. It can fluctuate. And so sometimes the person might be very alert, and some other times they might be too sleepy or they become unresponsive. And so if someone's level of consciousness seems unchanged, that's actually a red flag. So it doesn't really fit with delirium. And I want you to remember that delirium causes confusion and disorientation. So you're more likely to see that fluctuation. Now, letter D is also incorrect because memory problems in delirium happen quickly, almost very suddenly. And this is in response to the underlying issue, like possibly an infection like UTI or maybe dehydration. And if you notice a person losing memory over a long period of time, that's more likely a sign of dementia, which develops slowly over months or years, whereas delirium is rapid and it changes from day to day. And so for you to correctly answer this question, I want you to look for and remember the key characteristics of the delirium. Okay, again, it is going to happen as very acute, whereas the dementia can happen in gradual process. So that's a huge clue in distinguishing between the two. Now, you need to eliminate those options that talk about things that don't really fit the pattern about the condition. So if you're when you're assessing, so if a symptom is described as gradual or consistent, then it's probably not the right answer for delirium. All right, so we are inviting you to join Stanco's NCLEX coaching, and you will get to access the perks here. There's going to be 300 hours of animated video course, and there's also on-demand videos that you can access anytime. This also includes about 10,000 plus practice questions, also with audiobook and mock tests. We have CAT and test series as well, and this is something that you can access for the entire 12 months. And on top of that, this also includes the 200 plus NGN test questions. Let's proceed to question number 9. A home health nurse is assessing the safety of a client's living environment who has Alzheimer's disease. Which recommendations should the nurse provide to reduce the chance of injury? Select all that apply. A, add overhead lighting above staircases. B, store household chemicals on a high shelf. C, position the mattress directly on the floor. D, install additional locks near the top of exit doors. E, cover electrical cords with rugs. And so when you're assessing the safety of a home for someone with Alzheimer's disease, it's critical that to make that their environment minimizes their risk of injury. And so the correct options here are letters A, C, and D. Why letter A? Remember that clients with Alzheimer's often have issues with depth perception and spatial awareness, which makes navigating stairs very dangerous. And I want you to keep in mind that poor lighting only adds to the problem, because they might misinterpret those shadows or they will fail to see steps clearly. And so this can increase the chance of a fall. And so installing the bright overhead lights can really help them improve their visibility and make the stairs easier to see, and you're definitely going to reduce the risk of tripping here. Letter C is also correct. We know that Alzheimer's can impair their balance, coordination, and depth perception, and it's common for people to have difficulty getting in and out of their bed, or getting confused at night. And so if the mattress is on the floor, it will minimize the risk of injury from falling out of bed, especially during times of nocturnal restlessness or confusion. And this is also a simple way to make a big difference preventing serious injuries. Now, letter D is also correct because people with Alzheimer's often experience wandering, which can be dangerous if they leave the house unsupervised. And so when you're adding locks high up on exit doors, this can help prevent them from being able to open the door on their own. And they may struggle with spatial awareness and often won't look up. And so placing locks out of reach can reduce the chances of them wandering off and getting lost or also exposed to the environmental hazards. Now, options B and E are incorrect. Let's take a look into letter B, store household chemicals on a high shelf. We know that putting chemicals on a high shelf might seem like a good idea, but it's not enough to prevent access because people with Alzheimer's may still attempt to reach for these items, even if it means climbing or taking dangerous risks. And so the safer option is to lock hazardous substances away in cabinets that can't be opened without a key. Now, what about letter E, cover electrical cords and with rugs? So this one's a bit tricky. And so covering electric cords with rugs might seem like a solution, but this actually creates a tripping hazard because people with Alzheimer's often have gait disturbances and poor balance. And so adding rugs over cords only increases their chances of tripping. All right. And so tip for you in answering this question, you need to focus on the patient's abilities and their limitations. And so when you're asked about safety for someone with Alzheimer's, think about their cognitive impairments, such as poor judgment, problems in their vision, and impaired motor skills. So this will help you choose the safest options. And I want you to eliminate those choices that don't fully address the risk. And for instance, a high shelf doesn't prevent access, and the use of rugs to cover the cords could only create more hazards. So I want you to think about simple, effective solutions in this test question. Number 10. A nurse is educating a client who is scheduled to undergo electroconvulsive therapy for major depressive disorder. Which of the following statements made by the client demonstrates comprehension of the teaching? Option A, ECT is typically administered once a week for a total of 6 sessions. B, doctors usually recommend ECT before prescribing antidepressant medications. C, a muscle relaxant will be given to minimize the risk of injury during the procedure. D, a full course of ECT treatments will completely cure my depression. So I want you to look for clues. And so since the question is asking about the client's understanding about the electroconvulsive therapy, I want you to look for an accurate statement regarding the procedure and its effects. And we have option C as the correct answer this time, okay? Because during an electroconvulsive therapy, a muscle relaxant such as a succinylcholine is administered to help relax the muscles. And this is very critical because it will reduce the client's risk of injury during the induced seizure, which is part of the procedure. And without this medication, muscle contractions could lead to fractures or other injuries. So this is a critical safety step. Now, what about letters A, B, and D? These are the incorrect options. Specifically for letter A, this is incorrect because the ECT is usually done 2 to 3 times a week, not just once. And a full course typically includes 6 to 12 sessions, and depending on the patient's response. And so doing it only once a week would not be enough to get the desired effect. Letter B is also incorrect because ECT is not a first-line treatment. And ECT is usually considered only after medications and therapy haven't worked. So it's often used in cases of severe depressions when the treatments have not been effective. Now, letter D, another incorrect option. This is a very common misunderstanding. So take note that ECT does not cure depression, but it can provide significant symptom relief. And many patients feel much better, but to prevent relapse, they often need ongoing medication or other therapies as part of their long-term plan. So I want you to pay attention to the common treatments and their timing in the clinical practice, such as this procedure. Number 11. A nurse is gathering a health history from a client recently diagnosed with anorexia nervosa. Which questions should be included in the assessment? Select all that apply. Option A. How would you describe your current eating patterns? B. What weight do you believe would be ideal for you? C. Can you share your thoughts about your body image? D. How would you describe your interactions with your family? And E. What motivates you to lose weight? So when you're working with a client who has anorexia nervosa, it's really important to ask the right questions to get to the heart of the issue without reinforcing harmful thinking patterns. And we have the correct options here, letters A, C, and D. And why letter A? It's because this question gives you a clear picture of what the client is actually eating, how much, and if there are any patterns like restricting or purging. And so when you know their eating habits, this can help you assess the severity of their condition and also develop an appropriate treatment plan, especially around nutrition and rehabilitation. Letter C is also correct because body image distortion is a hallmark of anorexia, and people with anorexia nervosa often think they are overweight even if they are dangerously underweight. And so asking about their feelings can help you understand how distorted their self-image is, which can guide future therapies like maybe cognitive behavioral therapy that will be aimed at challenging and changing these distorted thoughts. Letter D is also correct because family dynamics can really impact anorexia. And I want you to recall that dysfunctional relationships like over-controlling behaviors or maybe high expectations can also contribute to the development and persistence of anorexia nervosa. And so when you ask this question in D, you might uncover those stressors or conflicts that can influence the client's eating behaviors, which could help in shaping a more holistic treatment approach. Now we have options letters B and E, which are all incorrect. Specifically on B, this is a big no-no because this question focuses on appearance and weight, which are exactly the things you want to avoid reinforcing someone with anorexia nervosa. And I want you to remember that their self-worth may be tied to how they look, and questions like this one can make those thoughts worse. And instead, treatment should focus on health, their well-being, and also the self-acceptance, not just weight. Now, letter E is also incorrect because asking why questions in this case is a bit tricky here because people with anorexia nervosa might not have a logical or rational reason for their behavior, and they could get defensive. And so this question can make them feel, actually, this is a judgmental type of question, which is not really going to help the patient. And so what you're going to do here is to ask open-ended, non-judgmental questions, which will help them to talk about their emotions and their thoughts in a more supportive way. So for you to answer the question here, you have to look for those options that focus on the client's emotions, their experiences, but not on weight or appearance. And this is going to support also their recovery. And I want you to also avoid those questions that are focused on weight and appearance, because this will reinforce the very thoughts that you're actually trying to help the client overcome. Number 12, a nurse is reviewing contributing factors for somatic symptom disorder with a newly licensed nurse. Which risk factors should be included? Select all that apply. Option A, exposure to traumatic events during childhood. B, pre-existing anxiety-related conditions. C, diagnosis of coronary heart disease. D, being older than 65 years. E, having excessive body weight. So let's talk about the contributing factors for somatic symptom disorder in this scenario. And so I want you to recall that the somatic symptom disorder is going to happen when people have physical symptoms that are real to them, but there's no medical explanation for these. Now, it's all about how the brain and emotions can make the body feel sick. And so when you're assessing the risk factors, you need to know that the two big risk factors for SSD are childhood trauma and anxiety disorders. So that's why those are the correct answers, letters A and B, because these play a big role in how someone might become overly focused on their physical symptoms, even if there's no real medical cost behind them. And the SSD tends to pop up more in younger adults, not older adults. And things like obesity or heart disease don't directly cause it. Now, we have options C, D, and E as incorrect choices. Why are they incorrect? Well, specifically letter C. We know that CAD is a serious medical condition, but it's not a psychological risk factor for SSD. And I want you to remember that people with SSD might worry a lot about their heart health, but their symptoms don't actually come from heart disease, but instead they focus on physical symptoms that aren't tied to any organic disease. D is also incorrect because SSD is more common in younger individuals, particularly ages 16 and 25, and this disorder typically manifests in adolescence or early adulthood and also persists chronically if not addressed. Now, letter E is also incorrect, although obesity is associated with psychological distress, but it's not a direct risk factor for the SSD. So for questions like this, where you're asked to select all that apply, you need to look for emotional or psychological risk factors like trauma or anxiety. So these are key in SSD. Now, I want you to watch out for the medical conditions such as the coronary heart disease or obesity, because these won't be risk factors for the SSD.
If you're looking for a full, structured study plan that guarantees success, then this is just the beginning. You can enroll in our full-length NCLEX crash course. For the past 3 years, more than 10,000 students have successfully passed the NCLEX using this program. This isn't just another review course. It's built from real insights gathered from 5,000 registered nurses who have passed the NCLEX. We know exactly what it takes to succeed, and we've designed this course to give you everything you need to pass on your first attempt. Here's what you'll get inside. 300+ hours of recorded video lectures covering all essential NCLEX topics in detail. 100 plus animated crash course lessons, making even complex topics easy to understand. 500 next generation NCLEX NGN questions so you can master the new exam format. 10,000 previously asked NCLEX practice questions, reinforcing your learning with real exam level difficulty. 30 full-length practice tests, helping you develop strong test-taking strategies. A comprehensive NCLEX ebook for in-depth review and quick reference. 1 year unlimited access, so you can study at your own pace without stress. This is your chance. Enrollment is open for a short time, and right now you can get in for 70% off. Enroll now and take control of your NCLEX prep. Visit website www.stancoastnclexcoaching.com. Link also in the description box. Now, let's dive into today's session and get started.
13. A nurse is educating a client who has recently been diagnosed with premenstrual dysphoric disorder, or PMDD. Which of the following client statements demonstrates correct understanding of the information? Option A. When my PMDD symptom appear, I should consume extra calories through dietary supplements. B. My symptoms will be at their worst while I am on my period. C. I recognize that PMDD makes my emotions shift suddenly. And D. I should stop exercising whenever I feel down. The answer here is option C. And why is that? Because PMDD is a severe form of premenstrual syndrome that causes major mood swings. There's also irritability, anxiety, and even depression. And it happens during the luteal phase of the cycle, which is the 2 weeks before the period starts. And the hormonal changes during this time make people with PMDD more sensitive, and serotonin, which regulates mood, is often involved in these mood shifts. And so when you're recognizing that mood swings are a big part of PMDD, this shows a solid understanding of the condition. Now, letter A is incorrect here. Why is this wrong? While the PMDD can cause the cravings, especially for carbohydrates or sweets, increasing the caloric intake with supplements isn't the solution. And it's better to focus on a balanced diet with complex carbs, proteins, and key nutrients like calcium and magnesium. We have letter B as one of the incorrect options here, because PMDD symptoms actually occur before their period, not during it. And so they peak in the 2 weeks before menstruation and typically will resolve within the first few days of the period. And so PMDD is not worse when they're menstruating, but it doesn't ease up once it begins. Now, what about letter D? This is also incorrect, right? And why is that? Well, exercise is actually helpful for managing PMDD. It also boosts serotonin and endorphins, which can help improve their mood and also reduce their depressive feelings. And stating that they're avoiding or stop exercising actually make things worse. I want you to remember that regular exercise like running or swimming is shown to alleviate symptoms of PMDD. Question number 14. A nurse working in an inpatient psychiatric setting is providing care for a client diagnosed with post-traumatic stress disorder. Which of the following symptoms are commonly associated with this condition? Select all that apply. Option A, poor self-esteem. B, disturbing repetitive dreams. C, difficulty maintaining focus. D, decreasing response to stimuli. E, a strong urge to repeatedly discuss the traumatic experience. So the question asks what symptoms are commonly associated with PTSD. So When you're thinking about PTSD, keep in mind the biggest red flags. And so this includes intrusive memories, such as nightmares or flashbacks. There's also emotional distress, which are negative self-image, also includes guilt or shame. And lastly, there's difficulty focusing due to heightened alertness. And so the correct options here are the following. We have letters A, B, and C. The reason why A is correct is because PTSD can distort self-perception. It's going to make individuals feel guilty, also ashamed, or even responsible for what happened. And these negative thoughts add to the emotional distress and make their healing even harder. Letter B is also correct. This is one of the hallmark symptoms of PTSD. And so what happens here is that the brain replays the trauma in the form of nightmares. And this can lead to distress and disrupted sleep. And the nightmares that they're going to have will really feel real, intense, and it makes seems that the trauma is happening all over again. And letter C, another correct option, because PTSD often causes cognitive fog due to hyperarousal and intrusive thoughts, and the hypervigilance wherein they are being constantly on edge makes it hard to focus, especially on daily tasks or when they're working. And so letter D and letter E are incorrect options. Take note that PTSD actually does the opposite in letter D. Okay, people with PTSD are often hyper alert, meaning their startle reflex is exaggerated, not diminished. And if their reflexes are slowed, it's usually due to a neurological conditions or other result to certain medications, but not PTSD. Letter E is also incorrect because most people with PTSD avoid talking about their trauma because it's too painful. But instead of obsessively repeating the story, they tend to shut down or withdraw to avoid triggering those distressing memories. So the main key takeaways in this question are the following. You need to think about that people with PTSD will have difficulty concentrating. They also have negative self-image, and they will have recurring nightmares. And people will also avoid discussions about the trauma, and they have that obsessive need to talk about the event. Unlikely. All right. Let's have number 15. A nurse is developing a care plan for a client who recently had a vagus nerve stimulator, or VNS, implanted. The nurse should assess for which of the following potential complications. Select all that apply. A, altered mental status. B, persistent cough. C, changes in vocal tone. D, pain in the neck area. E, onset of seizures. So I want you to look for those clues since this question is asking for potential complications from a VNS implant. So I want you to look for those side effects that could arise from the procedure. And so the answers here are letters B, C, and D. And why is B correct? There's that persistent cough. Well, this is going to happen because the vagus nerve stimulator device affects the areas like the larynx and pharynx. And when the device activates, it can trigger a reflex response, which can lead to coughing. And the intensity varies, but it's usually mild, but still it's something to watch for after the procedure. Letter C is another correct option here, changes in vocal tone. This is a common effect of the VNS. We know that the vagus nerve helps control the muscles in the larynx, but the stimulation or the VNS can cause this hoarseness, and this can also lead to pitch changes. And this is more noticeable when the device is first activated or if the settings are adjusted. But the good news here, these changes are often temporary and this may improve over time. What about letter D, pain in the neck area? Yes, that's also correct. And this is due to the surgical procedure and device placement. And so there's going to be some residual discomfort in the neck after the implantation or right after the implantation, but it usually gets better as the body adjusts to the device. But still, it's important to monitor it to rule out any other complications, like, let's say, infection or any other device issue. Now we have letters A and E as incorrect options here because disorientation or altered mental status is typically associated with ECT rather than a VNS. And onset of seizures is more commonly associated with ECT, not with the VNS placement. Number 16, a nurse is monitoring a client who has recently started sertraline 2 days ago. Which of the following signs should the nurse recognize as a potential indication of serotonin syndrome? A, skin rash. B, elevated body temperature. C, unexplained bruising. D, ringing in the ears. The answer is letter B. That's elevation of body temperature. And this is one of the hallmark signs of serotonin syndrome and often fatal condition. Also, the other signs include agitation, hyperreflexia. There's also tremors, and you should recognize fever or elevated body temperature as an urgent symptom. And so when you're going to see fever or elevated body temperature in a question about SSRIs, always think of serotonin syndrome. All right. What about letter A, C, and D? All right, for letter A, skin rash. Well, a rash is not typical of serotonin syndrome. We know that other medications can cause rashes, but this is not a defining feature of serotonin toxicity. Letter C, unexplained bruising is not a symptom of serotonin syndrome. And this could be related to other factors, or maybe with the use of anticoagulant, but it's not linked to serotonin syndrome. Ringing in the ears is also incorrect. It's more common with other types of medications, maybe antihypertensives or possibly furosemides, but not SSRIs. Let's have number 17. After this, I'm inviting you again to enroll to the NCLEX course, so kindly visit stankos.nclexcoaching.com. Number 17. A nurse is teaching a client with schizophrenia ways to cope with the anticholinergic side effects of fluphenazine. Which strategy should the nurse suggest to help reduce these effects? Option A, take an antacid to alleviate nausea. B, chew sugar-free gum to relieve dry mouth. C, take the medication in the morning to prevent sleep disturbances. D, use cooling techniques to manage fever. Now, I want you to look for that option that directly addresses a known anticholinergic effect. And so that would be option B. And I want you to look into the fluphenazine. And this is a medication that is an antipsychotic drug, specifically first generation, typical antipsychotic medication. And I want you to remember that dry mouth is a common side effect of the fluphenazine because of its anticholinergic effects. And so chewing sugar-free gum will help the patient maintain moisture in their mouth, and this can also prevent discomfort and possible complications such as cavities. Now we have letter A as one of the incorrect option here. That's because nausea is not a typical anticholinergic effect of fluphenazine, and so antacids would not help with that. And so this medication is more likely to cause dry mouth, blurring of vision, and possibly constipation. Letter C is also incorrect. We know that taking medication in the morning can help with sleep problems, but it doesn't address the specific issue of dry mouth. Letter D is also incorrect because fluphenazine doesn't typically cause fever. And the medication here is more associated again with dry mouth, constipation, and blurring of vision. So for this type of question, I want you to recall and focus on the specific side effects of the drug. And again, look into the anticholinergic effects. Number 18. A charge nurse is instructing a newly licensed nurse on caring for a client diagnosed with major depressive disorder, MDD. Which of the following statements by the newly licensed nurse indicates accurate comprehension of the information? A. Managing MDD in the maintenance phase typically takes between 6 and 12 weeks. B. The most effective time for using both medication and therapy is during the acute phase of MDD. And C. During the continuation phase, care focuses on addressing ongoing symptoms of depression. And D. The highest risk of suicide occurs within the first few weeks of a depressive episode. The answer is letter D. And why? Because the risk of suicide is highest in the early stages of a major depressive episode, especially within the first few weeks. And the reason for that's because at the start of depression, people feel overwhelmed with sadness, also hopelessness, which can make them more likely to think about suicide. And there's also that reduced energy levels initially. They might not have the energy to act on the suicidal thoughts, but as the treatment starts to work and their energy increases, often before their mood fully improves, they may have the motivation to follow through on those thoughts. Now, I want you to remember that there's also neurochemical changes. And so the antidepressants take time to work fully. And so during the early weeks of treatment, suicidal thoughts can persist even as the energy improves. And I want to emphasize that studies have shown that the risk of suicide is highest at the beginning of a depressive episode, and making close monitoring crucial during this time. Now, I want you to look into letter A here. It says managing MDD in the maintenance phase typically takes between 6 and 12 weeks. Well, this is incorrect. And why is that? It's because the maintenance phase is about preventing the relapse and keeping symptoms from coming back long term. And this phase can last for months to years, especially for people who have recurring episodes of depression. And the acute phase is the one where treatment is most active, and it typically lasts 6 to 12 weeks. And that's where the confusion might have come in. Now, letter B is also incorrect because the most effective time here is misleading. This is misleading. And I want you to remember that medication and therapy are effective across all phases, and that includes acute phase, the continuation phase, and also the maintenance phase. While it's true that both medication and therapy are crucial in managing the major depressive disorder, the effectiveness actually lasts beyond the acute phases. Now, I want you to remember that the acute phase, which is basically 6 to 12 weeks, is going to happen when the treatment is started. But the therapy here is still really important in the continuation phase to prevent the relapse, and the maintenance phase to keep the things stable in the long run. And so therapy is important not just at the beginning, but throughout the whole process. Letter C is also incorrect here. And the reason for that's because the continuation phase, which lasts for about 4 to 9 months, is actually focused more on preventing relapse rather than actively treating the symptoms. And so By the time when you're in the continuation phase, most symptoms should have improved during the acute phase. And the goal now is to maintain the remission and prevent the depression from coming back. And so you still keep taking the antidepressants and may continue therapy, but the focus is on stability rather than symptom management. Now, the main key takeaways here in the scenario is that suicide risk is highest in the acute phase. That's why option D is correct. And the continuation phase prevents relapse, not just treats symptoms. And the maintenance phase lasts longer than 6 to 12 weeks. And that is why option B is incorrect. And I want you to remember that medication and therapy are also critical in the continuation phase for relapse prevention. And that is why A is incorrect. Let's have number 19. A nurse has been involved in a prolonged and intense mass casualty event while working in the emergency department. Which of the following approaches can help reduce the likelihood of developing trauma-related stress? Select all that apply. A, participate in counseling sessions when available. B, take periodic breaks to eat and hydrate. C, refrain from reflecting on the event once it has ended. D, suppress emotional reactions in the days following the event. And E, engage in discussions with colleagues about the experience. The answers here are options letters A, B, and E. And why letter A? Well, counseling, especially trauma-focused therapies like cognitive behavioral therapy and eye movement desensitization and reprocessing can significantly reduce the likelihood of developing PTSD. And so these therapies can help process their emotions and also manage the intrusive thoughts while building coping strategies to prevent long-term distress. Letter B is also correct because during the traumatic events, it's easy to overlook basic needs like eating and drinking. And taking breaks to eat and drink ensures the body stays energized and hydrated, which supports emotional and cognitive function. And this can also help reduce stress and the risk of developing trauma-related disorders like acute stress disorders or PTSD. E is also correct. And talking about the traumatic experience with colleagues through critical incident stress debriefing, or known as CISD, can help the healthcare workers process their emotions and also reduce emotional suppression. And so this can prevent stress reactions, also reduces anxiety and PTSD in the long run. Now, what about options letter C and D? Why letter C is not helpful? It's because avoidance is actually a maladaptive coping strategy that can increase the risk of PTSD. And trying to suppress thoughts about the traumatic event often leads to flashbacks. This can lead to nightmares and emotional dysregulation. But instead, it's better to process the event through talking or possibly journaling. Letter D is also incorrect because suppressing emotions only worsens things in the long run. And so emotional suppression can lead to higher stress levels, which might contribute to chronic anxiety or depression or possibly PTSD. Number 20. A nurse is providing discharge instructions to a client who has been prescribed fluoxetine for PTSD. Which statement should the nurse include in the teaching? A, take the medication at night to help you sleep. B, this medication may lower your interest in intimacy. C, wear sunglasses outside because this medication can make your eyes sensitive to light. And D, to avoid urinary issues, try to urinate before taking this medication. The answer here is letter B. That is actually the statement here is this medication may lower your interest in intimacy. And so this talks about sexual dysfunction, and this includes reduced libido and possibly difficulty achieving orgasms. And so this is a known side effect of SSRI, such as the fluoxetine. And you should address this with the client to manage concerns early on. And I want to emphasize here that your focus would be on the side effect of the fluoxetine. Okay, this is critical patient education topic that often appears on the examination. What about letters A, C, and D? These are incorrect options, right? Well, for A, we know that fluoxetine is a stimulating SSRI, which can interfere with sleep. So it's best to take it in the morning to avoid insomnia. Letter C is also incorrect because fluoxetine does not typically cause photophobia, unlike the tricyclic antidepressants. And so this advice is incorrect. Now, what about letter D? To avoid urinary issues, try to urinate before taking this medication. Again, this is another incorrect option. This advice is going to be useful for a patient taking TCAs or tricyclic antidepressants, not SSRIs, because this does not cause urinary retention. Let's have number 21. A nurse is caring for a client on paroxetine for PTSD who mentions teeth grinding during sleep. What actions should the nurse take to manage this issue? Select all that apply. A, recommending the use of a dental guard. B, administering buspirone alongside paroxetine. C, switching to a different type of antidepressant. C, prescribing another SSRI. And E, increasing the paroxetine dosage. So this question is basically wanting you to focus on managing the side effects of bruxism, or that teeth grinding during sleep, instead of solely altering the medication. So this test wants you to reduce the symptoms without increasing patient discomfort. And that's why the options that you should select here are the following. We have letters A, B, and C. Letter A is an effective solution with the use of that dental guard. This can help prevent damage from bruxism during sleep. We know that the teeth grinding is a common side effect of the SSRI. And so with the use of this dental guard, this can provide immediate protection. Letter B is also correct because buspirone can help reduce anxiety, and it will also be helpful in some of the side effects of the paroxetine, including the teeth grinding. So this is another reasonable option. Letter C is also correct. Changing the antidepressants could also help if the bruxism is intolerable. And other SSRIs or possibly SNRIs may have a lower incidence of teeth grinding. However, it should be done cautiously and with, of course, the decision of the healthcare provider. So we have options, letters D and E as incorrect, specifically for letter D, because switching to another SSRI might not resolve the bruxism, because other SSRI could also cause the same side effect. And so this approach is also ineffective. Letter E, increasing the paroxetine dosage. This can also worsen the teeth grinding rather than reducing it. So you need to evaluate first the side effect profile before making the recommendation to adjust the dosage. So for you to answer this question, I want you to look for answers that directly address the symptom rather than medication adjustments. Let's have number 22. A nurse is assessing an adult recently diagnosed with Schizotypal personality disorder. How would this client's demeanor typically be described? A, controlling with inflexible tendencies. B, passive and lacking maturity. C, proud and frequently seeking validation. and D, withdrawn with limited emotional expression? The answer is letter D. Well, there's withdrawn and limited emotional expression. This is the correct answer. Because schizotypal personality disorder often involves social withdrawal. There's also that odd behavior, and there's also lack of emotional expression. And the clients with this type of personality tend to be isolated, and they struggle with forming close relationships, which is reflected in their demeanor. And so letters A, B, and C are incorrect. Now let's take a look into letter A here. So controlling with inflexible tendencies. So this sounds like more of a obsessive compulsive disorder, wherein the person is preoccupied with order and control. Whereas we have letter B, passive and lacking maturity. This is more aligned with dependent personality disorder, wherein someone relies heavily on others and avoids making decisions on their own. And letter C, this sounds more like a narcissistic personality disorder when someone needs constant admiration and validation. And so for you to answer this question, I want you to associate schizotypal personality disorder with social withdrawal. There is also eccentricity, and there's emotional detachment. And I want you to eliminate those answer choices that describe other personality disorders such as OCD, dependent personality disorder, and the narcissistic disorder or narcissistic personality disorder. 23. A client dependent on opioids undergoes emergency surgery. During recovery, the healthcare provider reduces the previously prescribed methadone dosage. What withdrawal symptoms should the nurse anticipate? Options: A, difficulty passing stool and disinterest in surroundings. B, restlessness and attempts to leave the medical facility. C, dry skin and frequent scratching near the surgical site. We have letter D, extreme fatigue and unwillingness to engage in physical activities. Now, the key clues to the question here includes the statement, a client dependent on opioids undergoes emergency surgery. So the client has opioid dependence, which means their body is used to opioids, and stopping or reducing the dosage can lead to withdrawal symptoms. And this brings us to selecting option letter B. That is restlessness and attempts to leave the medical facility. These are the symptoms to expect. And so when the methadone is reduced, the client here who is opioid dependent will often experience the intense cravings. They will get so anxious and they get so agitated. So this can make them feel so desperate to leave the hospital to find more drugs. And so letters A, C, and D are all incorrect because constipation is a side effect of opioids. It's not a withdrawal symptom. Also, the disinterest in surroundings is not atypical for opioid withdrawal. Now, dry skin and frequent scratching in option C sounds like a potential side effect of a medication or skin irritation, but it's not related to the withdrawal itself. Letter D, extreme fatigue can happen in opioid overdose, but it's not a typical withdrawal symptom. Now, I want you to remember about the key strategies here, that opioid withdrawal can lead to restlessness, agitation, and intense craving. So I want you to look for these answers in the option. Now, I want you to eliminate those answer choices that describe side effects of the opioids rather than withdrawal symptoms. 24. A nurse is developing a care plan for a client who exhibits repetitive behaviors. What intervention should be included? A, encourage participation in activities that benefit others. B, explain that the behavior does not serve a practical function. C, administer medications to suppress recall of underlying fears. D, help the client recognize that the behavior is a response to heightened anxiety. So the answer here is letter D. It's because repetitive behaviors are often coping mechanisms for anxiety or stress, and understanding this can make the client more open to the therapeutic interventions like cognitive behavioral therapy. And it's critical that the client recognizes the behavior's connection to their anxiety, as this awareness can be the first step toward managing it. Now we have letter A, B, and C as incorrect options. We have to encourage participation in the activities that benefit others. The statement here, encouraging participation in activities that benefit others, might sound helpful, but treatment for the repetitive behaviors focuses more on managing the behavior itself, not necessarily helping others. And so the goal is to address the client's coping mechanism. Letter B is also incorrect. So what you're supposed to, when it says here, explain that the behavior does not serve a practical function. Well, the client may already know this intellectually. What they need is help with understanding the emotion reason behind the behavior. Letter C is also incorrect. It states administer medications to suppress or recall of underlying fears. Is more about masking the symptoms rather than addressing the root cause of the anxiety and repetitive behaviors. And so the medications could help with symptom management, but this would not solve the underlying issue. And so here, you need to recognize that repetitive behaviors are often a response to the anxiety. And so you have to look for options that focus on helping the client develop awareness and coping strategies. And you need to eliminate those options that focus on distraction or the suppression of the symptoms rather than therapeutic intervention. Number 25. The parents of a teenager diagnosed with post-traumatic stress disorder have chosen to provide care at home. What is the most important intervention the home health nurse should prioritize? A, advise the parents to keep their child in a familiar setting. B, assist the parents in recognizing triggers that cause distress for their child. C, educate the parents about their child's potential difficulty in forming emotional bonds. D, explore the parents' mixed emotions regarding their child's struggles. And so this scenario involves a client, a teenager with a PTSD, a condition where the trauma survivors experience flashbacks or maybe emotional withdrawal, heightened anxiety. And so the priority here is helping the parents understand how PTSD affects emotional connections and attachment. And so the correct answer here is option C. The reason for that is because one of the most significant challenges in PTSD is emotional detachment, and many trauma survivors withdraw from close relationships as a defense mechanism to avoid feeling vulnerable. And parents must understand that this is not a personal rejection, but rather a symptom of PTSD. And so letter A, B, and C are letters A, B, and D rather are incorrect. And so A, one of the incorrect options here, we know that stability is important, but limiting a child's environment too much can also reinforce avoidance behaviors instead of promoting gradual exposure therapy. While letter B here says assist the parents in recognizing triggers that cause distress for their child, this seems to be helpful, but emotional detachment is a bigger long-term issue that affects family relationships and the child's mental health. Letter D is also incorrect. This may be therapeutic for the parents, but the focus should be on helping the child adjust and develop healthy relationships. So for you to correctly answer this question, you need to look for that option that directly benefits the clients first before addressing the family concerns. And I want you to remember that PTSD centers on emotional responses. So understanding emotional withdrawal is key here. And you also need to watch out for the distractors. So keeping the child in a familiar setting is good, but not the most critical intervention.
If you're looking for a full, structured study plan that guarantees success, then this is just the beginning. You can enroll in our full-length NCLEX crash course. For the past 3 years, more than 10,000 students have successfully passed the NCLEX using this program. This isn't just another review course. It's built from real insights gathered from 5,000 registered nurses who have passed the NCLEX. We know exactly what it takes to succeed, and we've designed this course to give you everything you need to pass on your first attempt. Here's what you'll get inside. 300 plus hours of recorded video lectures covering all essential NCLEX topics in detail. 100 plus animated crash course lessons, making even complex topics easy to understand. 500 next-generation NCLEX NGN questions so you can master the new exam format. 10,000 previously asked NCLEX practice questions, reinforcing your learning with real exam-level difficulty. 30 full-length practice tests, helping you develop strong test-taking strategies. A comprehensive NCLEX ebook for in-depth review and quick reference. 1 year unlimited access, so you can study at your own pace without stress. This is your chance. Enrollment is open for a short time, and right now you can get in for 70% off. Enroll now and take control of your NCLEX prep. Visit website www.stancoastnclexcoaching.com. Link also in the description box. Now, let's dive into today's session and get started.
The question here is, a 3-year-old child has been diagnosed with autism spectrum disorder. Which behavior should the nurse anticipate during the assessment? Select all that apply. Options are A, copies actions of others, B, seeks out physical affection, C, avoids making eye contact, D, participates in group play, E, repeats certain movements or activities, F, prefers interactions with peers over adults. Well, the correct answers here are letters C and E. So think about what we know about autism. And kids with autism spectrum disorder often struggle with social interactions. And so avoiding eye contact in option C makes sense. It's a classic sign. And E, wherein there's going to be repetitive movements like rocking or hand flapping, also can happen a lot because they provide comfort and predictability. And so we have the incorrect answers, letters A, B, and D. Now, for letter A, it's incorrect. It's because a child with autism doesn't usually copy others' actions or actively seek out hugs and cuddles. And with D, group play is another one that's not typical with kids with autism, and they often prefer playing alone or alongside others rather than directly with them. And as far as preferring peer interactions, and that's a big no. Many children with autism actually find interactions with adults easier than with peers. And so when you are going to be asked with this type of question, you need to focus on the two core ASD characteristics. And one is that social interaction difficulties. They will have avoidance of eye contact. They prefer alone time. And also the repetitive behaviors. There's going to be rigid routines. And you're supposed to eliminate those answers that require strong social engagement, such as group play or imitation. But when you're in doubt, you got to look out for those signs of social withdrawal and look for the repetitive behavior. These are the key autistic features. Number 27. A nurse is instructing a newly hired nurse about electroconvulsive therapy as a treatment option for bipolar disorder. Which statement by the new nurse reflects an accurate understanding? Options: A, ECT is used to prevent future episodes of bipolar disorder. B, ECT should not be given to clients with suicidal thoughts. C, ECT is beneficial for individuals with extreme manic symptoms. And D, ECT is the first-line treatment for bipolar disorder. The correct answer here is that's actually going to be letter C. All right, so correct that one. This is not letter A, but this is letter C. Now, why is letter C the answer here? Well, the ECT is going to work great when the client will require a quick relief of their symptoms, like if someone's experiencing intense agitation or even psychosis. And the ECT can also help balance the neurotransmitters in the brain, which helps calm things down. Now, the ECT itself, like I've said, that's supposed to be letter C, not letter A. And so this is going to be indicated for severe mania, especially when medications are not helping the client. Now, the incorrect options here are supposed to be letters A, B, and D. Now, why A is incorrect? Well, ECT isn't used to prevent future episodes of the bipolar disorder. It's really intended for managing those acute episodes. And once the symptoms improve, clients will be switched to other treatments like mood stabilizers or maybe other therapies to keep things in check for long term. Letter B, another incorrect option here. Well, ECT is actually helpful for people with suicidal thoughts, and it's one of the fastest treatments for severe depression, and it can quickly help stabilize mood and reduce those suicidal thoughts. And letter D is also incorrect. It is not the first treatment choice for bipolar disorder. There's medications like mood stabilizers and antipsychotics. These are the first go-to. And the ECT is more of a backup when meds aren't working or can't be used. So to summarize this, again, ECT is great for severe mania and for those cases where medications just aren't helping the patient. And the first line treatment for bipolar disorder is always going to be meds. And don't worry, ECT can actually help suicidal clients by providing quick relief. So let me just do a quick change in this one right here. It's supposed to be letter C. Okay. There you go. I changed that. Now we have item number 28. A nurse is developing a care plan for a client diagnosed with bipolar disorder who is currently in a manic state. Which of the following interventions should be included? Select all that apply. Options: A, communicate using a direct and firm tone. B, ignore the client's concerns. C, allow flexibility in behavior expectations. D, set consistent boundaries. And E, provide brief and clear instructions. So when you're caring for a client with bipolar disorder who's in a manic state, certain interventions are very critical to help manage their behavior and to ensure their safety. And so we have the answers. We have letter A as one of the answers here. We also have D and E. Now, why is A correct? Well, For those people with manic state, they can be impulsive. And so also they test the limits because their mood is elevated and often they do not think clearly. And so when you are using a firm but calm tone, this will help provide a structure without making the situation feel confrontational. It will set clear boundaries. It can reduce the anxiety, and also it can help keep things from escalating. D is also correct. This is setting consistent boundaries because clients in a manic episode can struggle with the impulse control. They also have the poor judgment and even manipulation because their brain function is affected. Now, with setting the consistent boundaries, this is the key to reducing manipulation. It will promote a sense of safety and keeping the environment predictable. And this is especially important for helping them regulate their behavior. Letter E is another correct option here because mania often comes with cognitive issues like racing thoughts and trouble focusing. And so complex instructions are hard to follow. And so when you are keeping communication short, making it clear and simple, it will help them process the information better and makes it easier for them to understand what is expected. Now, what about the other options here? B and we have B, C. All right, so these are the incorrect options. So if you selected letter B, this is a bad idea. Even though someone may be in a manic episode, their concerns are still valid. And when you're ignoring, this can actually damage the therapeutic relationship, making them feel unheard. And it can also increase agitation or possibly paranoia. And so think about maintaining that therapeutic communication. There's always that active listening and validation to build trust. Letter C is another incorrect option. While it might seem compassionate to let things so flexible, but clients with mania often show erratic and unpredictable behavior. And so if we are too flexible, it can actually make things worse by enabling manipulative behavior, or it can encourage further escalation. And so when you're sticking to consistent expectations, this is much more effective in maintaining stabilities. So when you answer this type of question, you gotta make sure that you gotta explain things to the client, making it simple and direct, because they get so distracted easily. And also you need to be consistent with limits. So this is done to prevent the manipulative behavior, and it also creates a structured and predictable environment. Another thing is that you need to stay firm but calm, a non-confrontational approach to help maintain stability and also reduce inappropriate behavior. And we also need to set clear behavior expectations because, again, if there's too much flexibility, this can be overwhelming. They need to have that structure. And lastly, you have to listen and acknowledge their concerns. So to build trust and keep them engaged in the care. 29. A nurse is checking in with a client who is using chlorpromazine to manage schizophrenia. Which of the following symptoms should the nurse anticipate seeing the most improvement in? Select all that apply. Options: A, visual and auditory disturbances. B, difficulty in socializing with others. C, confused and unclear speech. D, unusual or strange actions. E, lack of drive or initiative. The answers here are letters A, C, and D. Why letter A? Well, chlorpromazine, again, this is a first generation antipsychotic, and this is most effective at treating positive symptoms of schizophrenia like hallucinations. It could be visual, auditory, and delusions. And This is because chlorpromazine works by blocking the dopamine receptors, specifically in the mesolimbic pathway, which is implicated in the production of these positive symptoms. Letter C, another correct answer. It's because chlorpromazine is effective at reducing disorganized speech, which is another positive symptom of schizophrenia. And when you're addressing the dopamine imbalance, it will help improve cognitive and speech coherence, and also will help in having that clear communication. Letter D is another correct option because the chlorpromazine can target those bizarre behaviors or disorganized motor behavior, which is classified as another positive symptom. And the medication can also help reduce the impulsivity, the aggression, and uncoordinated movements. And so the incorrect options here, such as letter B, which is difficulty in socializing with others, and also letter E, lack of drive or initiative. Now let's have letter B first. Well, the chlorpromazine has little to no effect on the negative symptoms and of the schizophrenia, and also it has little effect into the impaired social interactions. And so these symptoms result from the dopamine dysregulation in the brain regions, all right, which chlorpromazine does not address effectively. And we also have E, lack of drive or initiative. This is also termed as avolition, which is another negative symptom that chlorpromazine does not treat well. And I want you to recall that negative symptoms often require other interventions such as social skills training or possibly newer atypical antipsychotic medication. And so when you answer this question, I want you to pay attention to the clue words visual and auditory disturbances. We also have disorganized speech, okay? And there's also, or confused or unclear speech, there's also unusual or strange actions. So these clues should immediately signal that the question is focusing on positive symptoms of schizophrenia, which are best managed by the first generation antipsychotic chlorpromazine. Let's have number 30. A nurse is educating a client with a tobacco addiction about nicotine replacement therapy. Which statement by the client shows they understand the instructions? Options: A, I must stop using the nicotine gum after 12 months. B, I should chew the nicotine gum quickly for about 15 minutes. C, I should avoid eating before chewing a piece of nicotine gum. And D, nicotine gum is a safe option if I'm pregnant. The answer is C, because food and beverages can interfere with the absorption of nicotine from the gum. And to ensure effective absorption, the client should avoid eating or drinking for at least 15 minutes before and while chewing the gum. So the incorrect options here are letters A, B, and D. Why letter A is incorrect? Well, nicotine gum should not be used for longer than 6 months because prolonged use can increase the risk of dependency, which is counterproductive to the goal of quitting smoking. B, another incorrect option here. The gum should be chewed slowly and intermittently to allow for proper nicotine absorption. And so if it said chewing quickly can lead to a rapid increase in the nicotine levels, it can cause side effects like nausea and also dizziness. We also have letter D as an incorrect option because nicotine products should be avoided during pregnancy because this can harm the developing fetus and also increases the risk of pregnancy complications. So your test taking strategy here should be the clue words. Make sure that you pay attention about avoiding eating and also chewing the nicotine gum quickly, and also safe if I'm pregnant. So again, the clue avoid eating stands out as a clinical part of the nicotine gum usage. And the phrase is 12 months, this one right here. This is quite of a lengthy use of the nicotine gum. And again, this can lead to dependence. All right. And also with letter D, this should alert you because, again, this should be avoided by the pregnant client. Well, we have number 31. A nurse is providing education to a client with bipolar disorder about ways to prevent a relapse. Which information should be included? Select all that apply. Options: A, start taking medications again as soon as symptoms return. B, trouble sleeping may be an early warning sign of relapse. C, moderate caffeine intake can help avoid relapse. And D, engaging in therapy sessions can reduce the risk of relapse. And E, loss of interest in enjoyable activities may indicate a depressive relapse. The answers here are letters B, D, and E. Why letter B? And why is it one of the correct answers? Well, the sleep changes are often one of the first red flags of a relapse. So if the client starts needing little to no sleep, which is a sign of mania, or maybe they begin sleeping too much, that's a sign of depression. So it's a clue that things might be shifting. And so you have to encourage them to keep track of their sleep and speak up if they notice a change. Letter D is also a correct option because regular therapy like cognitive behavioral therapy or maybe interpersonal and social rhythm therapy can help the clients recognize these early warning signs, and also they can help manage their stress and also build healthier routines. So this is basically a solid way to support medication and keep symptoms in check. Letter E is another option here. This is referred to as anhedonia, I should say. So if the client suddenly stops enjoying those hobbies, or if they start avoiding social activities, that could mean they're slipping into a depressive episode. So you got to pay attention to the changes to catch a relapse early. Now, for the incorrect options here, it includes letter A and letter C. For letter A, well, you're not supposed to, or you just don't start meds only when symptoms return, okay? So medications are supposed to be taken regularly, not just when symptoms show up. And take note that stopping and starting can actually make things worse and can cause more severe episodes over time. Letter C is also incorrect. Caffeine is not really your friend here. While some might think caffeine could help them stay awake and alert, but it can actually make things worse by triggering manic symptoms. Possibly they're going to end up with anxiety and restlessness. And it can also mess up with the balance of the neurotransmitters, and it can lead to manic episodes. So it's better to avoid it altogether. So you need to pay attention about the client's sleep patterns, because this can signal a relapse, and to make sure that the client keeps up with therapy to help prevent relapses, and make sure that you have to watch for the loss of interest in activities, because it's a sign of depression, and make sure that the clients stay on the medications regularly. Do not let them skip the doses. And also to avoid caffeine, because it can trigger mania. 32. A nurse in a psychiatric emergency unit is admitting a client diagnosed with major depressive disorder accompanied by anxiety. Which intervention should the nurse prioritize? Option A, encourage the client to engage in therapy sessions. B, educate the client about possible medication side effects. C, implement continuous one-on-one supervision. D, assist the client with personal care tasks. The answer is letter C, implement continuous one-on-one supervision. So when you're admitting a client with major depressive disorder and anxiety, your first priority is to make sure they're safe. And the correct action in this case is to implement continuous one-on-one supervision. And the reason is because clients with major depressive disorder often have feelings of hopelessness. They also have suicidal thoughts due to the changes in serotonin, norepinephrine, and dopamine levels. And when you add anxiety to the mix, it increases the risk of self-harm because anxiety makes distress worse and it can fuel impulsive behavior. And also, make sure that you implement the close observation. You have to place the client under one-on-one observation so you can immediately intervene if they show signs of self-harm. And so this is very critical for suicide prevention, which is, according to Maslow's hierarchy of needs, should always come first. Safety before anything else. Now, why is letter A incorrect? Well, this is important, but not urgent, right? Therapy like cognitive behavioral therapy or interpersonal therapy, they're super important for long-term recovery, but it doesn't address the immediate risk of suicide. Now, if the client is severely depressed and having suicidal thoughts, they might not even be in a state to fully engage in therapy right away. So think about safety first, then followed by therapy. B is another incorrect option here. We know that teaching the client about potential medication side effects it's also important, but it's not your top priority when they're in immediate danger of self-harm. So the focus needs to be on ensuring safety first. Once the client is stable, then you can focus on things like medication education. Now, we also have letter D. This is assisting with the personal care task. Why is this not a priority? Well, people with major depressive disorder often struggle with daily tasks like eating or bathing or dressing, mainly because they lack the motivation or energy. However, as much as ADL assistance is important, it doesn't directly address the life-threatening risk of suicide. So you need to ensure the client is safe through observation. It comes before helping with activities of daily living. So main key takeaway here would be to prioritize safety. Again, one-on-one or close observation. 33. Neuroleptic malignant syndrome is a life-threatening reaction associated with antipsychotic treatment. Which clinical manifestations should the nurse recognize as indicative of this condition? Select all that apply. A, yellowing of the skin. B, excessive sweating. C, severe muscle stiffness. D, critically high body temperature. E, heightened sensitivity to light. Now, this question is testing your ability to recognize the hallmark signs of neuroleptic malignant syndrome, or NMS, which is a medical emergency caused by the excessive dopamine blockade in the brain. And the NMS, or the neuroleptic malignant syndrome, is a rare, but it is a severe reaction to antipsychotic medications such as haloperidol or chlorpromazine or maybe risperidone. And this can be fatal if not identified and managed promptly. So the correct answers here are letters B, C, and D. There's that excessive sweating, diaphoresis. So in NMS, the autonomic nervous system is in distress. It can lead to profuse sweating because the body is struggling to regulate the temperature. And so this symptom is a red flag that should prompt your immediate intervention. Letter C, critically high body temperature. That's actually severe muscle stiffness. That's letter C. And so one of the defining features of the NMS is the lead pipe rigidity. What is this? This is going to happen when the muscles become incredibly stiff and resistant to the movement. So this is different from the muscle twitching seen in the serotonin syndrome. Totally different. Another is critically high body temperature, hyperthermia. The NMS can cause extreme fever, greater than 103 degrees Fahrenheit or greater than 39.4 degrees Celsius. And the reason for that is because the central nervous system has kind of like dysregulated. And so the body fails to cool itself down, and this hyperthermia can lead to multi-organ failure if not treated immediately. So our incorrect options here include letter A and letter E. So when you see the yellowing of the skin, this would indicate liver dysfunction. That's the jaundice, right? And this is not a hallmark symptom of NMS. We also have letter E, heightened sensitivity to light or photophobia. This is more commonly associated with meningitis or maybe migraines, but not NMS. And so for you to answer this question, I want you to focus on the patterns of symptoms that make sense together. So again, recall about NMS. It is a neuromuscular and autonomic dysfunction. So you have to recall about fever, muscle rigidity, autonomic instability. There's going to be excessive sweating. The blood pressure will tend to fluctuate fast, and the client will have tachycardia. And so you have to avoid getting distracted from the other options here, such as the jaundice and the photophobia or sensitivity to light. All right. And so when you are going to be asked about any kind of life-threatening condition, you need to look for those answers that indicate severe systemic effects. Again, this is the fever, the muscle breakdown, or possibly organ failure, which is part of the NMS. 34. In the emergency room, a client shares a plan for suicide and agrees to voluntary admission to the psychiatric unit. What information should the nurse provide to address the client's question? How long will I be here? Select all that apply. A, we will discuss that after the healthcare team evaluates your condition. B, you'll need legal representation to help decide that. C, once the forms are signed, you no longer have any control. D, a court hearing is required before you can leave the facility. And E, you can leave unless you're at risk of harming yourself or others or unable to take care for yourself. And F, you need to be stable before being discharged because of your safety concerns. The answers are options A, E, and F. So for letter A, so when a client is voluntarily admitted, the healthcare team needs time to assess the condition before determining the appropriate length of stay. And so this will also ensure the best treatment plan for the client's safety and well-being. Another option here is letter E. With voluntary admission, it means that the client has the right to leave unless their condition indicates a risk of self-harm, maybe harm to others or an inability to meet basic needs. And in those cases, the healthcare team may recommend further care or even initiate an involuntary hold if necessary. So take note of those words. Another option here is letter F. That's one of the correct answers. And so the primary goal of psychiatric hospitalization is safety. So even if a client is admitted voluntarily, they won't be discharged until they are stable enough to manage their condition outside the hospital. And so the incorrect options here include the letters B, C, and D. We have the letter B, totally incorrect. This is not true for voluntary admissions. A lawyer would only be necessary in legal matters such as court-ordered hospitalizations. Letter C, another incorrect option, because voluntary admission doesn't mean a loss of rights. Clients still have autonomy and can request discharge unless they meet criteria for involuntary hospitalization. Letter D, another incorrect option, because a court hearing is only needed for involuntary commitments, not voluntary admissions. So for you to answer this question, I need you to look for the clue words in the question. Okay, so that's the voluntary admission, and the client agrees, indicate that this isn't an involuntary commitment. All right. And so the correct answers should reflect a balance of clients' rights and safety considerations. Let's have number 35. A nurse is instructing the guardian of a school-age child on the use of a methylphenidate patch. Which of the following guidelines should the nurse provide? Options. A. Place the patch on the child's waist area. B. Use the patch within 6 months after opening the tray. C. Apply one patch twice daily. And D. Keep the patch on for 9 hours. The answer here is letter D, because methylphenidate patches are designed to be worn for approximately 9 hours each day, usually applied in the morning to help manage the ADHD symptoms throughout the school day. And the patch should be removed after 9 hours to avoid excessive exposure to the medication and also to minimize the side effects such as insomnia. And that is why it's supposed to be worn during the daytime. And so letter A, B, and C are incorrect options. And why letter A is incorrect? Well, the patch should be applied to the hip, not the waist area. It's recommended to place a patch on a clean, dry surface of the skin, also a hairless area, to ensure proper adhesion and to facilitate effectiveness. And also, when you apply the patch onto the waist area, this might cause discomfort and improper adhesion. Letter B is also incorrect. The correct guideline to use the patch is within 2 months after the tray has been opened. And so if you're going to teach them to use the tray once it's open beyond the time frame, it can lead to reduced potency and it will be ineffective in the treatment. Letter C, apply one patch twice daily. This is also incorrect because the patch is designed for once daily use. And so if it's going to be applied twice a day, it could result in overexposure to the medication. It can lead to adverse effects like appetite suppression and, again, insomnia, right? It's supposed to be taken or supposed to be applied for the duration of 9 hours during the daytime. 36. A nurse is assessing a client diagnosed with generalized anxiety disorder. Which of the following symptoms should the nurse anticipate? Select all that apply. Options. A. Feeling on edge. B. Trouble sleeping. C. Persistent excessive worry for at least 6 months. D. Acting on impulse without consideration. And E. Slowed reaction time. So this question is asking which symptoms the nurse should expect in a client diagnosed with generalized anxiety disorder. And so I want you to focus on the symptoms related to heightened anxiety, like excessive worry, restlessness, and I want you to eliminate those options that do not align with generalized anxiety disorder, such as impulsive behavior or delayed reflexes. Now, why the answers are letters A, B, and C. Why are those the correct options? Well, for A, that's feeling on edge or restlessness. Or when the person is unable to relax, this is a classic symptom of GAD. And this happens because the sympathetic nervous system is in overdrive, making people feel so tense, they get so fidgety or constantly uneasy, even when there's no clear reason to be anxious. We also have option letter B, trouble sleeping. The struggle to fall or to stay asleep is a big red flag for GAD. Again, it's because persistent worry and hyperarousal make it hard to wind down. It can lead to exhaustion and a messed up sleep schedule. Letter C is also one of the correct options. And this is the key diagnostic feature of GAD. And so when a person is to be diagnosed, the individual must experience uncontrollable, excessive worry for at least 6 months. Take note of that. And often blowing things out of proportion and stressing over potential worst case scenarios. And I want you to take note of those. All right. So the incorrect options here are options letters D and E. That's acting on impulse without consideration and slowed reaction time. So why is D incorrect? Well, this is not a GAD symptom. In fact, people with a GAD tend to overthink and they hesitate, fearing they'll make the wrong choice. And so impulsivity is more common in bipolar disorder or borderline personality disorder, wherein decisions are made quickly without much thought. Again, that's a big clue right there. And letter E is one of the incorrect options, delayed or slowed reaction time. With a GAD, they don't usually have the slowing of reflexes. Instead, they have muscle tension, especially in the neck, shoulders, and jaw. And they also get headaches or jaw pain from clenching their muscles, but their reflexes remain normal. And so I want you to recall this or remember that excessive worry or feeling an edge in option A, or let's say restlessness, the trouble sleeping, and these are the core symptoms of GAD. And the impulsive decision making and delayed reflexes are not commonly associated with GAD as well. All right. Now let's have number 37. So again, we are inviting you to enroll to the NCLEX course via stankosnclexcoaching.com. So kindly pay a quick visit. Number 37. A nurse is assessing a client immediately after receiving electroconvulsive therapy. Which of the following findings should the nurse anticipate? Select all that apply. A. Intestinal obstruction due to impaired peristalsis. B. Temporary disorientation. C. Excessive urination. D. Decreased blood pressure. E. Short-term memory impairment. The question is asking you about the expected findings immediately after electroconvulsive therapy. So you should look for the effects of the procedure that can happen right after the treatment. And so these options are supposed to be letters B and E. Temporary disorientation and short-term memory impairment. All right. So the client here will have that temporary confusion. This is expected. This happens because the induced seizure activity can affect the brain function temporarily. And the client will get confused, but it will somehow clear up in a few hours. But for some people, it can last up to a day. So it's just a part of the brain's recovery process. E, which is also a correct option, this is also expected. This can cause some temporary memory issues like trouble recalling recent events. And this usually will improve within hours to days. And the reason for that is because the seizure that was induced during the ECT can disrupt the neural pathways involved in memory processing. But over time, things will typically return to normal. And so we have letters A, C, and D as incorrect options. You're not supposed to expect here a paralytic ileus. That's in letter A. We know that the client will be getting anesthesia or succinylcholine. This can slow down gut motility temporarily, but it shouldn't stop the intestines completely. All right. And so once the anesthesia wears off, the bowel activity should go back to normal. Letter C, that's polyuria. It's not a thing with ECT as well. Yeah, we know that the procedure mainly affects the brain and the nervous system, but it doesn't mess with the kidney in a way that would cause excessive urination. Letter D, another incorrect option, decreased blood pressure. That's not true. What can happen instead is hypertension. because the sympathetic nervous system kicks in due to the seizure activity. It can cause that temporary spike on the blood pressure. And we need to monitor the client's vital signs, especially the BP, to make sure everything stays stable. Okay, but not hypotension. Again, I want you to remember that the most common after effects of ECT can be that transient memory loss, and there's also that transient disorientation. These are expected findings. 38. Which approaches should a nurse use during crisis intervention? Select all that apply. A, goal-directed, B, active, C, reflective, D, passive, and E, interpretative. Now, when a person is experiencing a crisis, they are often overwhelmed, they are unable to think clearly, and they will struggle to cope with their emotions. And so, you'll be acting as a nurse in the NCLEX, right? And so, your role in crisis intervention is to provide immediate support, also provide guidance and structure. And so, your answers should be options letters A and B. Why letter A? Because during the crisis intervention, the nurse should be goal-directed, and this is to assist the client with coping the crisis. And with crisis intervention, it isn't about long-term exploration of feelings. It's about helping the client regain stability as quickly as possible. And so if you are goal-directed, it simply means that you are going to identify the specific achievable steps that will help the client regain a sense of control. And in simple terms, you're helping the client find a way forward rather than leaving them stuck in distress. Letter B, another correct option. Your role here should be to assume an active role in assessing the current situation and also to facilitate the interview with authority. So this simply means that you're going to step in to assess the situation, you're going to provide clear direction, and you're going to guide the conversation. During the crisis, the client may be disoriented, emotional, or even in a state of panic. So you need to be you need to have that active role. Again, you have to give them clear direction and you have to guide the conversation. And so options letter C, D, and E are incorrect. Why is C incorrect? We know that reflective approaches are great for long-term therapy. This can include counseling or psychotherapy, but these are not ideal for crisis intervention. And again, recall that crisis intervention is about immediate support, while reflection is more of, it can be beneficial for self-exploration over time. And so think of this like needing a firefighter to put out a fire versus needing a therapist to talk about how the fire affected you months later on. And so letter D, passive, is also an incorrect option. This simply means letting the client lead the way without much input or structure from the nurse. And so this is not going to work in a crisis. So the person who's in a crisis usually needs someone to take charge and someone that will provide guidance. And so if the nurse is passive, the client may remain overwhelmed or even worsen in their crisis state. Letter E, interpretative. This is also incorrect because this approach focuses on analyzing the deeper meaning behind a client's thoughts and behaviors, which is not helpful in crisis intervention. Again, the priority in a crisis is stabilization, not deep psychological analysis. All right. So your key words here to answer this question, that's the crisis intervention. It's a huge clue. So it signals you that the nurse needs to take immediate, structured, goal-oriented nursing interventions. All right. Let's have number 39. A nurse is creating a care plan for a client with conversion disorder. Which nursing intervention should be included? Option A, assess for self-injurious behaviors once daily. B, promote time alone for self-reflection in the client's room. C, allow unrestricted discussion about physical symptoms. D, explore different coping mechanisms with the client. Now, I want you to recall that conversion disorder is when a person experiences neurological symptoms such as paralysis, maybe blindness or seizures that seem quite physical, but there's no medical cost behind them. So it's all psychological distress that's been converted into physical symptoms. Now, people with this disorder often don't realize that their symptoms have psychological roots. And that's why the focus should be on addressing the underlying emotional issues and teaching healthy ways to cope with stress. And that is why our answer here is letter C. Okay? That is to allow unrestricted discussion about physical the correct answer is letter D. That's explore different coping mechanisms with a client, not letter C. Again, why is letter D the answer here? It's all about helping the client how to handle stress in more productive ways. And so you want to introduce things like relaxation techniques, stress management, and also cognitive behavioral therapy. And so these strategies can help the client work through the emotional issues that are causing the physical symptoms. And the goal is to help the client regulate their emotions and also to stop the physical symptoms from recurring. And we have the incorrect options. These are your letters A, B, and C. Why letter A is incorrect? It's because conversion disorder is not usually linked to self-injury, but clients might have underlying conditions like depression or anxiety that could increase their risk. So you need to monitor them more frequently for any self-harm risk. And the words here, once daily, okay, is it making this option incorrect? Okay, this should be done in much more of a continuous way, frequently, especially if the client also has comorbid psychiatric conditions like PTSD or depression. Letter B is also incorrect. Promoting time alone for self-reflection in the client's room. This actually can make things worse because with social isolation, this can increase their distress. It can reinforce maladaptive behaviors. So instead of having them do that, you should encourage social engagement. And so activities like group therapy or occupational therapy can help the client process their emotions in a much healthier way. So rather than encouraging the isolation, your focus should be on having them interact with you and also getting them engaged with others to help them express their feelings and recover functionally. Letter C is also incorrect. Allowing unrestricted discussion about physical symptoms is not ideal either. So when you're letting the client talk endlessly about their physical symptoms, this might just reinforce the disorder. And so it's very critical that you're going to limit the time spent discussing physical symptoms, and you need to gently guide the conversation back to emotional concerns and coping mechanism. And the reason for that is because it's all about balancing the validation of what they're going through while also shifting the focus on how they can manage their stress and emotions better. And so your test-taking skill here is when you are creating a care plan with this client with a conversion disorder, you should keep in mind about building adaptive coping strategies. Because the goal here is to make sure that they develop ways to manage their stress in a much healthier way. And so they should be engaged in relaxation therapy instead of getting stuck in a cycle of physical symptoms and emotional distress. And when you're going to be encountering another type of question like this one, asking about conversion disorder or any somatic symptom related disorder, you need to think about psychological rather than physical intervention. Okay, so your focus here should be to help the client develop emotional regulation, not just focusing on the physical symptoms. And also, you need to encourage social interaction and functional recovery instead of isolation. And don't forget about providing frequent monitoring if there is a risk of self-harm or depression. Number 40. A nurse is educating the family members of a client with a substance use disorder. Which statement from a relative demonstrates a correct understanding of the teaching? Select all that apply. A. The main objective of treatment is to completely stop substance use. B. We must acknowledge that our loved one is accountable for their condition. C. Attending an Al-Anon support group will assist our family members' recovery. D. Avoiding codependent behaviors will contribute to successful treatment. Letter E. Expressing emotions about substance use can help in the recovery process. The correct answers here are letters A, D, and E. There you go. Letter A is absolutely correct because abstinence is the cornerstone of any effective treatment for substance use disorder. And it's very critical for you to understand that this is not just about stopping use for a short period. There's going to be a need for long-term abstinence, which will help reduce health risk and also allows the brain to have that enough time to heal and also to rewire. So this is what we call as neuroplasticity. So the treatment programs like 12-step groups or medication-assisted therapy will help focus on helping individuals stay sober. Letter D is also correct. This is very critical here because codependency happens when family members unknowingly support or enable the person's substance use. Let's say they're covering up the behavior or making excuses for the client. And so by stopping these behaviors, the family members can allow their loved one to face the consequences of their actions, which is essential for accountability and growth in recovery. And studies show that addressing codependency can also lead to much better long-term outcomes. Letter E is also a correct option. We know that emotional expression is a key in recovery, and many people with substance use disorders use substances as a way to cope with underlying issues like trauma, anxiety, or depression. And so therapies like motivational interviewing or cognitive behavioral therapy can help these individuals express their emotions in healthy ways and also to process their feelings about substance use, which can play a huge role in their recovery. We have letters B and C as incorrect options. Letter B, not quite. So we know it's true that the individual is responsible for their recovery efforts, but substance use disorder is a chronic brain disease, not a simple choice. It causes neurological changes in the brain, which makes people feel compelled to keep using substances even when it's harmful. However, once someone recognizes they have the disorder, they are responsible for seeking help and taking steps toward their own recovery. Letter C, another incorrect option. This one is a little bit tricky. The Al-Anon is a support group intended for family members of people with substance use disorders. It's not intended for the person with the disease, okay? And so the individual with a substance use problem would benefit more from participating in a group like Alcoholics Anonymous or the AA, all right? So these groups are designed to help recover the individuals. So AA is totally different from Al-Anon, which is going to help the family members cope and set healthy boundaries. So it's more about supporting the family than the person in recovery. Okay. So I want you to keep in mind that with a successful recovery from substance abuse, it involves a much more comprehensive approach, and the family members really play a critical role here. And the main goals should be eliminating the enabling behaviors. This is what we have as the codependency, right? And also promoting abstinence for long term, and also addressing emotional factors that contribute to the disorder. Okay, so I want you to eliminate those other options that are misleading. For example, we have letters B and letter C. Alrighty, let's have number 41. A nurse is caring for a client with substance-related psychosis who is experiencing auditory hallucinations. The client says, "The voices won't stop bothering me." Which of the following responses by the nurse are appropriate? Select all that apply. A, are the voices telling you to harm yourself? B, why do you think the voices are only speaking to you? C, the voices aren't real because I don't hear them. D, that must be frightening for you. E, when did you first begin hearing these voices? So I want you to imagine you're caring for a client who's experiencing auditory hallucinations. They're telling you the voices won't stop bothering me. So how are you going to help this client? Well, the answers are options letters A, D, and E. Why letter A? Are the voices telling you to harm yourself? This is asking about safety. Okay, this is very critical here. What you need to do first is to ask what you want to make sure the client is safe. And so if the voices are telling them to harm themselves or others, that's a very serious situation. And so this can help you understand if there's any immediate risk, so you can take action if necessary. Letter D is also correct. This is validating the client's feelings. So we know that hearing voices can be incredibly scary for someone with substance-related psychosis. And so saying something like, it must be scary or it must be frightening to hear these voices, you're actually showing empathy, and it's helping them feel heard. And so it's very important that you're not ignoring their emotions or brush off what they're experiencing. So validation is going to help in building trust, and it will also encourage them to open up. Letter E is also a correct option. This is assessing the timeline. It said, when did you first begin hearing these voices? So this is actually helping you gather the crucial information, and also gives you an insight into whether the hallucinations are tied to possible substance use, or let's say withdrawal, or if there's another underlying issue. And so understanding when the symptoms begin can help you plan the best course of action for the treatment. While the other options here, such as letters B and C, letter B is actually asking with a why. You're not supposed to ask them with the why questions. So saying something like, why do you think the voices are only speaking to you? This can only make the client feel defensive or like they're being interrogated. And I want you to recall that people with psychosis often have difficulty explaining their hallucinations logically. And so when you're asking why, this can actually increase their anxiety and make the situation worse. So instead, you need to stick to open-ended questions that can focus on their feelings or experiences without sounding judgmental. Letter C is also incorrect. The voices aren't real because I don't hear them. You're not supposed to argue with their reality. So if you're telling them the voices aren't real because I don't hear them, this can come off as confrontational. Even though that you know the voices are not real, they feel real to the client. And so arguing with them might make them more distressed or cause them to distress you. So instead, you have to acknowledge what they're going through without dismissing their experience. So your strategy in answering this question is always to check for safety. Okay, ask them if the voices are telling them to harm themselves. Also, to validate their emotions, because it's scary to experience hallucinations. So let them know you understand. And another thing is to get the information on when the hallucination started. Okay, so this will help with organizing the treatment plan. And you also avoid asking why questions, because this can feel accusatory or it can be confusing. And again, or lastly, do not argue about the hallucinations. You have to accept the reality and keep the conversation grounded.
If you're looking for a full, structured study plan that guarantees success, then this is just the beginning. You can enroll in our full-length NCLEX crash course. For the past 3 years, more than 10,000 students have successfully passed the NCLEX using this program. This isn't just another review course. It's built from real insights gathered from 5,000 registered nurses who have passed the NCLEX. We know exactly what it takes to succeed, and we've designed this course to give you everything you need to pass on your first attempt. Here's what you'll get inside. 300 plus hours of recorded video lectures covering all essential NCLEX topics in detail. 100 plus animated crash course lessons, making even complex topics easy to understand. 500 next generation NCLEX NGN questions so you can master the new exam format. 10,000 previously asked NCLEX practice questions, reinforcing your learning with real exam level difficulty. 30 full-length practice tests, helping you develop strong test-taking strategies. A comprehensive NCLEX ebook for in-depth review and quick reference. 1 year unlimited access, so you can study at your own pace without stress. This is your chance. Enrollment is open for a short time, and right now you can get in for 70% off. Enroll now and take control of your NCLEX prep. Visit website www.stancoastnclexcoaching.com. Link also in the description box. Now, let's dive into today's session and get started.
42. A nurse is assessing a client for signs of dementia. What information from the client's and family's history should the nurse anticipate discovering the assessment? Select all that apply. Options: A, the family is uncertain when the symptoms began. B, the client has demonstrated noticeable changes in personality. C, the client displays a lack of interest and negative outlook. D, the symptoms have developed gradually over time. E, the client struggles with focusing on others. And F, the client confesses to feeling down or hopeless. The answers are options A, B, D, and E. Why letter A? Because dementia has a slow, it has gradual onset, and so family members often have difficulty pinpointing exactly when those changes started. And B is also correct because a shift in the personality, such as increased irritability or suspicion or withdrawal, is common in dementia. Letter D is also correct because unlike conditions like delirium, which has a sudden onset, dementia progresses over several months or several years. And lastly, we have letter E. Cognitive decline affects the concentration and attention. So it's going to make it harder for the client to engage with others. And so the incorrect options are letters C and letter F. So for letter C, the sadness, this is the lack of interest, negative outlook. So there's going to be apathy. There's also pessimism. These are more indicative of depression rather than dementia. So discard this one. Letter F, this is client confesses to feeling down or hopeless. This is associated with feelings of sadness, which is commonly associated with depression. And this is not a primary symptom of dementia. So When you are asked this with this type of question, I want you to pay attention to the clue words. There's that gradual onset, gradual over time, and also the words dementia. It can progress slowly. It actually affects the memory, cognition, personality, not the mood in the same way depression does. 43. The nurse is assessing an elderly client for signs of cognitive impairment using Minicog dementia assessment tool. The client is asked to remember 3 words: cat, crackers, and toys. After completing a short task, the nurse asks the client to recall the words. The client responds with toys, boys, and joys. What should the nurse do next? Options: A. Administer the test again when a family member is available. B. Refer the client for further evaluation by a healthcare provider. D. Document that the client exhibits echolalia. And D. Have the client try recalling the original words once more. So let's talk about why the answer is letter B. This is refer the client for further evaluation by a healthcare provider. This is the best answer. Well, the Minicog test, this is a quick way to check for cognitive impairment, and it involves 2 simple tasks. All right, so the first one here is word recall. So you as a nurse will give the client 3 words to remember. The second here is you're going to have the client do the clock drawing test. So you're going to ask the client to draw a clock showing a specific time. Now, in this case, the client was given 3 words: cat, crackers, and toys. But the client recalled different words. So they said toys, boys, and joys. So this is pretty much a red flag for a possible dementia, because the client did not just forget the words, but they substituted similar sounding words instead. And so this suggests memory impairment and possibly semantic confusion, which is difficulty distinguishing word meanings, which can be an early sign of Alzheimer's disease or maybe another type of dementia. Now, why not letter A? Wait for a family to be present during the testing? No, you don't need a family member there to conduct the test, but you should communicate your concerns to the family members. If this is part of the care plan, they're allowed to be involved in the care. And so the test results stand on their own as the indicator for further evaluation. Letter C is incorrect. It said here, document that the client exhibits echolalia. Not quite. So I want you to remember that echolalia is going to happen when someone repeats the exact same words over and over like an echo, hence the name. And so what this client did was come up with rhyming words, which is totally different. Now, for letter D, this is have the client try recalling or have them repeat, okay, once more. So repeating the test immediately is not recommended. So if the client struggles with recall, retesting right away would not change the cognitive function. It might just result to confusion or possibly more frustration. So instead of doing that, you need to make sure that the client has a full assessment by a healthcare provider. So the main key takeaways here for answering this question. So if the client struggles with a Minicog test, it's a sign that they may have cognitive impairment. And your next step here is to refer them for a full neurological and cognitive evaluation. All righty. Let's have, let me just check real quick. All right. Let's have number 44. A client's spouse whose wife was diagnosed with Alzheimer's disease 6 years ago tells the nurse, "I'm so happy that my wife is beginning donepezil or Aricept for her condition." What should the nurse respond to the husband? Options: A, the medication will allow the client to function at the same level as 6 years ago. B, this treatment is most effective in the early stages of the disease. C, it has been proven to work in the final stage of the condition. And D, the medication has many potential side effects. And so when you're answering this kind of question, you need to focus on the clues in the scenario. All right. So we have here the word Alzheimer's disease. All right. It said 6 years ago. So this means the client is likely in a moderate or advanced stage. And also he said about beginning donepezil Aricept for her condition. So this clue is telling us that the client is just starting the medication. And when the spouse says, I'm so happy, so this basically suggests an expectation that the medication will bring significant improvement. However, you got to be direct in pointing out the obvious here. So the correct answer is letter B. And why is letter B the option? So let's recall first that the Aricept or donepezil, it belongs to a class called cholinesterase inhibitors, which is going to work by increasing acetylcholine levels in the brain. And remember that acetylcholine is essential for learning and memory, but in Alzheimer's disease, neurons that produce it progressively deteriorates. And so donepezil cannot stop or it cannot reverse neurodegeneration, but it can slow symptom progression, particularly in the early stages when more cholinergic neurons are still functional. And so if the spouse is expecting a drastic improvement, it's important that you need to set realistic expectations. So it is very important to remember that the medication may help slow down worsening of the symptoms, but it won't bring the client back to where when they were 6 years ago. All right. And so the incorrect statements or the incorrect answers or options are letters A, C, and D. Okay. Letter A, it's because it is unfortunate. The current Alzheimer's medication can, no medications for Alzheimer's can reverse. Nothing. And so once the neurons die, they do not regenerate. And again, donepezil will only slow down further memory loss, but it cannot restore lost abilities from 6 years ago. So that's why you need to eliminate letter A. Letter C is also incorrect. So in the last stages of Alzheimer's, most cholinergic neurons are gone. And remember that donepezil works by enhancing acetylcholine. And so there is no more point in boosting something that no longer exists. And studies also show that the benefits of cholinesterase inhibitors significantly decrease in late stage Alzheimer's disease, which is why they are not commonly prescribed at that point. Okay. Letter D is also incorrect. The medication has many potential side effects. We know that donepezil does have side effects. We have the nausea, diarrhea, muscle cramps, insomnia, and sometimes slowed heart rate. But these generally are mild, not really the main concern in the situation. I want you to go back into the question stem. It's about effectiveness, it's not asking about the safety. So focusing on the side effects misses the point. I want you to remember that or recognize that. So when you answer this kind of question, you need to remember that Alzheimer's medications do not reverse the disease. It will only help slow down the progression when the diagnosis was established early on or when the medication was started right away at the onset, right? And you need to question those extreme answers like return to normal or proven effective in later stage. Those are false statements. And so you also need to focus on effectiveness first, and you have to look into the side effects after, okay? Unless the question specifically asks about the risks. Let's have number 45. A nurse is conducting an initial assessment of a client diagnosed with schizophrenia. Which of the following observations should then be noted as positive symptoms? Select all that apply. A, emotionless facial expression. B, delusion of persecution. C, hearing voices that are not present. D, repetitive exaggerated arm movements. D, decreased drive to complete tasks. F, rhyming or repeating words excessively. Now, when you are assessing a client who has schizophrenia, it's critical to understand what qualifies as a positive symptom. So I want you to recall that other test item that we already had earlier. And so these are symptoms that reflect abnormal behaviors or experiences that shouldn't be there. So the answers should be the following: letters B, C, D, and F. So it includes letter B, that's delusion of persecution. So this is happening when a person has irrational beliefs, like thinking they're being targeted or harmed by others, or they believe that people are spying on them or plotting against them. So these are false beliefs, and this is a classic positive symptom of schizophrenia. We also have letter C. This is auditory hallucination. And so when they're hearing voices when no one is speaking is another common symptom, right? So these are sensory experiences that are not grounded in reality, and they happen because of the disordered thinking in schizophrenia. So it's like the person is experiencing something that isn't actually there. Letter D is also one of the correct options. So if the person is doing things like repetitive, exaggerated arm movements, then it's a sign of disorganized behavior. So this could sometimes be linked to other things like catatonia or other disorganized motor symptoms, which are considered positive because they represent unusual or inappropriate behaviors. We also have letter F, rhyming or repeating words excessively. This is what we call as use of clang associations. And so this is one related to speech. And so this is something that can happen when someone uses words that sound alike but don't make any sense together, like saying, the bell fell on the well. I fell and fell. So this is a type of disorganized speech, which is another hallmark of positive symptom because it shows abnormal thought processes. Now we have the other options here, A and E. A, this is flat affect in letter A. This is happening when someone has reduced emotional expression, like not showing any facial expression or sounding monotone. And this is a negative symptom, which means there's a lack of normal emotional responses rather than the presence of abnormal behaviors. E is also incorrect. This is decreased drive to complete tasks. This is the lack of motivation, all right? And this is also termed as avolition. This is referring to not feeling motivated to do anything, like not starting tasks or not finishing them. And this is another negative symptom, and this also reflects the absence of usual functioning. Okay, so I want you to remember this. Positive symptoms are abnormal behaviors like delusions, hallucinations, strange movements, and disorganized speech, while negative symptoms are about missing behaviors like a lack of motivation, flat affect, or emotional expression, lack of emotional expression, I should say. Number 46. A nurse is caring for a client prescribed valproic acid. Which blood tests should the nurse advise the client to have on a regular basis? Okay. Select all that apply. Options: A, blood sugar levels, B, potassium levels, C, platelet count, D, amylase levels, E, liver function tests? The answers are options C, D, and E. Well, with letter C, platelet count. Why? Because the valproic acid can cause thrombocytopenia, and it makes it really important to monitor platelets regularly because thrombocytopenia means higher risk of bleeding, right? And so it's a very good idea to keep a close eye on this one. All right, teach your patient about that. Letter D, another correct option, amylase level, because this medication can sometimes cause pancreatitis. Remember that. This is the inflammation of the pancreas. So there should be periodic checking of the amylase levels to help catch it early on. Okay, we know that the amylase can spike whenever there is pancreatitis. Letter E, liver function tests, also a correct option here because the valproic acid can also cause liver damage. So the patient will need regular liver function tests. We are talking about AST, ALT to make sure everything is working properly. And so if there's any sign of damage, yes. And so there's going to be a need to review the medication and also to discontinue the medication soon to prevent major complications. So we have options, letters A and B as incorrect choices. Why letter A? Well, the blood sugar changes are not something we typically worry about valproic acid. It doesn't have any association at all. Okay, so this doesn't need to be monitored unless the patient has diabetes or another reason for concern. B is also an incorrect option. The potassium levels don't tend to be affected by the valproic acid, so you're not going to need this as well. All right, let's have number 47. A nurse is educating a client who has a new prescription for escitalopram for generalized anxiety disorder. Which of the following comments by the client shows they understand the instruction? Options: A, I should avoid crushing the pill before taking it. B, it's best to take this medication on an empty stomach. C, I need to gradually stop taking this medication. D, I should follow a low sodium diet while on this medication. Now, I want you to remember about escitalopram, and this is popularly known to a brand Lexapro. Okay, so this is a drug that is classified as a selective serotonin reuptake inhibitor. We remember that as SSRI. So it works by increasing serotonin levels in the brain. And so when the client takes escitalopram for a while, their brain adjusts to having more serotonin available. And so the correct answer here would be letter C. And why is that? Well, even though the scenario does not say the client is stopping the medication, we as nurses, we are supposed to educate clients in advance about potential issues they might encounter later. Okay, so this option right here, I need to gradually stop taking this medication. This is going to help prevent dangerous withdrawal symptoms if the client ever decides to stop or needs to stop for a medical reason. So gradual tapering is very critical to avoid the withdrawal symptoms. And this includes dizziness, irritability, and flu-like feelings. And so when the client stops abruptly, this can lead to very uncomfortable and potentially dangerous effects. So there's going to be a need to discontinue the medication gradually. So we have incorrect options here, letters A, B, and D. Letter A, it said, I should avoid crushing the pill before taking it. Well, the escitalopram is available in a form that can be crushed or taken whole, depending on the client's preference. So crushing it is not a problem unless specified otherwise by the manufacturer. We also have letter B, it's best to take this medication on an empty stomach. This is also incorrect because the medication can be taken with or without food. However, you have to keep in mind some clients may experience gastrointestinal upset, in which case taking it with food can probably be helpful, but there is no strict requirement for it to be taken on an empty stomach. Letter D is also incorrect because there is no need for a low sodium diet with escitalopram. However, older adults may be at risk for hyponatremia, but this doesn't really require dietary restrictions. So I want you to remember that on the NCLEX, questions may often focus on preventing potential complications rather than just immediate concern. So even if stopping the medication isn't currently happening, it's still a priority teaching point because it affects client safety in the future. And that is why we have letter C as our best answer. 48. Following an assessment of a client with recurrent depression, a nurse assesses the client's likelihood of self-harm. Which of the factors below could increase the client's risk of suicide? Select all that apply. Options: A, decreased activity levels, B, suppressed anger, C, risk-taking tendencies, D, intense guilt feelings, E, slowed mental and physical activity, and F, long-term debilitating illness. Now, when you're assessing suicide risk, there are several key factors that can increase vulnerability. And so one of those is actually suppressed anger. And that's why B is one of the correct answers. Among the others, we have C, D, and F. And so with B, with suppressed anger, when the individual holds their anger instead of expressing it, it can build up internally, it can lead to emotional distress, and over time, this can contribute to suicidal thoughts or behaviors. We have letter C, risk-taking tendencies, because people who are impulsive may act on suicidal thoughts without fully thinking through the consequences. And this lack of hesitation can make them especially vulnerable. We also have letter D, intense guilt feelings. I want you to acknowledge that many individuals with depression also experience overwhelming guilt, sometimes feeling as though they've failed or caused harm to others. And so this can deepen their feelings of hopelessness and also can increase their suicidal ideation. We also have letter F, long-term debilitating illness, because chronic conditions that affect daily life can also lead to despair and hopelessness, especially if the person feels their quality of life is poor or that they are a burden to others. And so we have the incorrect options, including letters A and E, decreased activity levels and slowed mental and physical activity. While option A are symptoms of depression, they are not necessarily risk factors for suicide. I want you to remember that individuals who are very withdrawn and have low energy may lack the motivation to act on suicidal thoughts. Okay? So that's why A is one of those. And we also have letter E, which is long-term debilitating illness. So your strategy here should focus on clue words like self-harm, and also think about the factors that increase that risk. So look for themes of impulsivity, emotional distress, and hopelessness. 49. A client with delusions states, "I am Iron Man and insist on being called that." The belief seems unshakable. Which nursing interventions should the nurse use when interacting with this client? Select all that apply. Options: A, offer the client activities with structure. B, regularly address the client by their name. C, agree with the client's belief that they are Iron Man. D, acknowledge the situation humorously. E, administer medication as needed for symptoms. And F, discuss logically why the client cannot be Iron Man. You should be selecting letters A and B. Offer the client activities with structure and also regularly assess the client by their name. And so for letter A, when you're keeping the client engaged in structured tasks, this can help redirect their focus away from the delusions. And B also promotes reality orientation, and this can also reinforce their true identity without directly confronting their delusion. Now, we have options C, D, and E as incorrect choices. With C and D, agree with the client's belief that they are Iron Man and acknowledge the situation humorously. So these options actually can reinforce the false belief instead of helping the client connect with reality. And we have letter F. The delusions aren't based on logic. And so when you try to argue with them, this will not be effective. Now you have letter E as well, administer medication as needed for symptoms. We know that medications help psychotic symptoms, but they won't immediately fix delusions. And so I want you to pay attention to the following clues. We have delusions. There's also unshakable belief. So pay attention to those clue words in the entire test item. Again, the delusions do not respond to logical explanation. So the best approach here is reality orientation without confrontation. We have number 50. A client has been prescribed chlordiazepoxide or Librium to help manage alcohol withdrawal symptoms. Which of the following signs might suggest the need for an additional dose of this medication? Select all that apply. Options: A, shaking or tremors. B, heightened anxiety. C, rapid heart rate. D, fluctuations in mood. E, goosebumps. F, high blood pressure and fever. You should be selecting these cluster of answers. We have letters A, B, C, and F. And why letter A? That's shaking or tremors. These are often seen in the hands, and these are early signs of alcohol withdrawal. And if they worsen, it may indicate the need for additional dose of the medication to prevent progression to a much more severe withdrawal symptoms. We don't want this patient to go in seizure. No, we don't. Letter B, heightened anxiety. And so when they are withdrawing, they all often experience severe anxiety due to the changes in the neurotransmitter activity. And so increased anxiety may signal that the current dose is not enough to stabilize the nervous system. We also have letter C, rapid heart rate. And so when there is tachycardia, this is a critical sign that the autonomic nervous system is overstimulated due to the alcohol withdrawal. And this can quickly lead to life-threatening complications if not managed properly. Yeah, we don't want those tachycardia to go worse, right? Letter F, we have also high blood pressure and fever. Okay, so when there is going to be hypertension and fever, this too suggests worsening of the withdrawal. So if you're not going to pay attention about these two, this can escalate to delirium tremens, or the DTs, which is the life-threatening condition characterized by hallucinations and seizures. All right, you don't want to ignore these. And so we have the incorrect options, letters D and letter E. These are fluctuations in mood and goosebumps. So D, mood swings are common in withdrawal symptoms, but are not a specific trigger for adjusting the medication dose. I want you to pay attention about that, okay? Mood swings are not specific trigger for the adjustment of the medication dose, okay? Your focus is on physical symptoms like tremors, tachycardia, and hypertension. And we have goosebumps. We call that a spiral erection. This can be seen in patients with opioid withdrawal, but they are not typical of alcohol withdrawal. So this symptom alone would not indicate the need for additional medication.
If you're looking for a full, structured study plan that guarantees success, then this is just the beginning. You can enroll in our full-length NCLEX crash course. For the past 3 years, more than 10,000 students have successfully passed the NCLEX using this program. This isn't just another review course. It's built from real insights gathered from 5,000 registered nurses who have passed the NCLEX. We know exactly what it takes to succeed, and we've designed this course to give you everything you need to pass on your first attempt. Here's what you'll get inside. 300 plus hours of recorded video lectures covering all essential NCLEX topics in detail. 100 plus animated crash course lessons, making even complex topics easy to understand. 500 next generation NCLEX NGN questions so you can master the new exam format. 10,000 previously asked NCLEX practice questions, reinforcing your learning with real exam level difficulty. 30 full-length practice tests, helping you develop strong test-taking strategies. A comprehensive NCLEX ebook for in-depth review and quick reference. 1 year unlimited access, so you can study at your own pace without stress. This is your chance. Enrollment is open for a short time, and right now you can get in for 70% off. Enroll now and take control of your NCLEX prep. Visit website www.stancoastnclexcoaching.com. Link also in the description box. Now, let's dive into today's session and get started.
A nurse is working on a psychiatric unit receives a call from the son of a recently discharged client. The son reports that his father has been prescribed memantine Namenda, in addition to donepezil, Aricept. The son asks why his father needs the extra medication. How should the nurse respond? Options. A. Namenda and Aricept are often prescribed together to help slow dementia progression. B. Aricept has a short half-life and Namenda has a long half-life. They complement each other. C. It could be that Aricept alone is not adequately managing his dementia. D. Namenda is more effective than Aricept, and your father will eventually stop taking Aricept. The answer here is option B. Okay? Alrighty. Now, why is this the correct answer? So I want you to identify first the core issue. The client has dementia, likely Alzheimer's disease, and has been prescribed both memantine and donepezil. And the focus is on the question of why both the medications are necessary and how they work together. So I want you to pay attention to the keywords here. Extra medication, together, and also the issue itself, dementia, the progression of the dementia. So this can help you guide in getting into the answer that discusses how these drugs complement each other rather than one drug being better than the other. And so I want you to eliminate misleading information. So you have to watch for any choice that suggests one drug is superior or that tapering off the first medication is standard practice. So take note that both drugs serve unique purposes, and the goal is not to replace one with the other, but to use them together for maximum benefit. Now, I want you to also look for a mechanistic understanding. We know that donepezil and memantine work on different ways or pathways in the brain. And so you need to understand the mechanism so to help you rule out options that pertains misunderstanding between the two medications. And so the correct answer here is actually going to be letter A. Let me correct that real quick. That is letter A. not letter B. All right. So there you go. The answer for this question is letter A. This is a correct statement that reflects the reason for prescribing both medications. Okay, so the donepezil or Aricept, this is the cholinesterase inhibitor that can help increase the acetylcholine, which is a neurotransmitter essential for memory and learning. Whereas the memantine or the Namenda, this is the NMDA receptor antagonist. And so this is going to work to regulate glutamate, which is a neurotransmitter that can be toxic in excess and can also cause neuronal damage. But in Alzheimer's disease, right, this is going to be given together with donepezil. They're going to be very important in slowing the cognitive decline by addressing different aspects of the disease process. So letter A is the correct option because it explains the complementary role of the medications in managing dementia. And also this emphasizes that they work together to slow progression, which is the main goal treatment for the dementia. Now we have letters B, C, and D as incorrect options. For B, this statement is inaccurate because both donepezil and memantine have long half-lives, over 60 hours. So the notion that one has a short half-life and the other has a long half-life, this is totally wrong. They are actually going to work. They are going to complement with each other in their mechanisms of action. And the reason they are used together is not related to differences in half-life, but they are intently given to the fact that they target different pathways in the brain. Okay, this is complementary action. Letter C is also incorrect. Yeah, because this statement could mislead the son into thinking that the use of memantine indicates treatment failure with donepezil. This is not the case. And the purpose for the adding the memantine to the treatment is to complement with donepezil's action, not because donepezil has failed. And so again, both medications work on different pathways, and the combination of the two is going to enhance symptom management, and this is going to slow the progression of the disease. All right. So the statement in letter C is suggesting wrongly that donepezil alone is inadequate. Now we have letter D here. Namenda is more effective than Aricept. This is also incorrect. This is because neither Namenda nor Aricept is superior to the other, and they're supposed to be used together for their complementary effects. And there is no indication that a patient would stop one medication in favor of the other unless there are significant side effects of intolerances. Now, the idea that Aricept will be discontinued is not a standard practice when adding memantine. Both medications serve unique functions in the management of Alzheimer's disease. All right. So I want you to look for those options that emphasize complementary actions of the medications rather than suggesting one is superior to the other, and also to eliminate those options that mention half-life differences unless it's clearly about the medication's mechanism or metabolism. And also focus on the slowing progression instead of curing or improving dementia, because Alzheimer's treatment is aimed at managing symptoms and also slowing cognitive decline. So if you're going to see any clues or words that say cure, improving, these are huge red flags. 52. The nurses visiting the home of a client recently diagnosed with Alzheimer's disease. The client has started taking lorazepam due to the heightened anxiety. The nurse cautions the family about the potential side effects of lorazepam. What should the family report to the healthcare provider as a serious side effect? Options: A, slowed reflexes, B, unusual agitation or excitement, C, excessive tiredness, D, headaches. Your answer should be option B. That's unusual agitation or excitement. So I want you to recall that benzodiazepines such as lorazepam or Ativan are supposed to calm anxiety and also to promote relaxation. But in some cases, the exact opposite can happen. This is what we call as paradoxical excitement. And so instead of feeling sedated, some people, especially older adults or those with neurological conditions such as Alzheimer's, they may become agitated, they will become restless, get aggressive, or hyperactive. And this reaction is not just unusual, it can also be dangerous. It can worsen behavioral symptoms and can put both the patient and their caregivers at risk. And so since this means the medication is not working as intended, it should be stopped immediately, and the healthcare provider needs to be notified right away to find a safer alternative. And so we have the incorrect options, including A, C, and D. Now for letter A, slowed reflexes, totally incorrect, because we know that lorazepam is a central nervous system depressant, so it's expected for it to cause sedation and delayed reflexes. And this side effect is a dose dependent, meaning a lower dose might help if it becomes an issue. However, if the slowed reflexes lead to falls or mobility problems, the healthcare provider should be informed for possible dose adjustments, not an immediate stop to the medication. Letter C, excessive tiredness, also is incorrect because feeling tired while taking lorazepam is expected because of its sedative effects. While it can be annoying, it's not dangerous like paradoxical excitement, which requires stopping the drug. So if fatigue becomes a problem, changing the dose or maybe timing the medication may help. We have letter D, headaches, another incorrect options because headaches can happen with lorazepam, but they're usually mild and temporary. And this is not a reason to immediately stop the medication unless the headaches are severe or they become persistent or may come with other concerning symptoms like high blood pressure or vision changes. So my tip for you in answering this question is first to identify the serious harmful reaction that requires immediate action, and that is letter B. Okay, that's paradoxical excitement. And also I want you to recognize expected side effects that are not dangerous and can be managed with dose adjustments. And so these are options A, C, and D. And you got to be also extra cautious with vulnerable populations, especially older adults with Alzheimer's, because they may react differently to the medication. 53. A nurse is preparing an educational session for healthcare staff regarding substance use disorders in elderly clients. Which key point should be included in the training? Options: A, older adults often use justification as a defense mechanism for substance use. B, cognitive decline leads to increased substance use in aging adults. C, the risk of substance dependence rises after retirement. And D, aging individuals require larger doses doses of substances to feel the same effects. So when you are preparing an educational session on substance use disorders in elderly people, it is very critical that you understand first the unique risk factors that affect this age group. And so the answer here is going to be letter C. All right, why is that? Because retirement can be a major life transition that brings about stress, such as feelings of loneliness, there's going to be loss of purpose, or maybe financial difficulties. And these stresses can push some older adults to turn to substances, especially alcohol or prescription medications, as a coping mechanism. And it's not uncommon for someone who's feeling isolated or down after retirement to reach for the substances as a way to deal with depression or boredom. And there's actually a lot of evidence supporting this. And studies also show that life transitions like retirement or loss of a spouse or declining health can trigger substance use issues. And so when you're training healthcare staff, this is a really important point to highlight, which is the social and emotional impact of retirement, which can lead to an increased risk of substance use. And so we have options, letters A, B, and D as incorrect choices. Now, we know that letter A, this is justification or rationalization. It's actually occurring. And so denial is actually the most common defense mechanism used by people with substance use disorders, and they might deny they have a problem at all. And this is particularly true in older adults who might feel embarrassed or stigmatized by admitting a substance use issue. Letter B is also incorrect. It's true that cognitive decline can affect older adults, but it's not typically the cause of increased substance use. And I want you to remember that substance use is more likely to be a response to life changes like retirement changes, or retirement, or maybe health issue, or maybe death of a spouse, rather than as a result of cognitive decline. We also have letter D. Aging individuals require larger doses of substances to feel the same effects. Actually, the opposite is true, because as people age, the bodies process substances like alcohol and medications more slowly because of the changes in the liver and kidney function. And so this simply means that older adults are more sensitive to substances, and they often need smaller doses. And when you're giving them larger doses, this could increase the risk of toxicity. So the key takeaway here is to remember that older adults are at an increased risk of substance use following retirement due to stressors like social isolation, their loss of purpose, and also emotional distress. Alrighty, let's have 54. A nurse is caring for a client in the early stages of Alzheimer's disease who has been prescribed donepezil. Which of the following should the nurse include when explaining this medication? Options: A, you will need to be tested for kidney issues before starting this drug. B, this medication should be taken before bedtime each night. C, if you develop nausea or diarrhea, stop taking the medication immediately. And D, avoid using over-the-counter pain relievers like acetaminophen while on this drug. Now, I want you to remember about donepezil, which is a medication commonly prescribed for early Alzheimer's disease to help improve memory and cognition. And when explaining this medication to a patient, it's very critical to give them clear and accurate information. And that is why letter B is the correct answer. Okay? And the reason for that's because donepezil can cause some gastrointestinal side effects like nausea and diarrhea, especially in the early stages of treatment. And to help minimize these issues, it's recommended to take the medication at bedtime, and this way the client can sleep through the worst of the GI discomfort, and they'll also avoid any daytime drowsiness that might interfere with their daily activities. Again, the medication can also cause daytime drowsiness. And since some people can experience drowsiness when taking this donepezil, taking it at bedtime can actually help ensure they wake up feeling more refreshed without daytime fatigue affecting their activities. And when the person is asleep, they're also less likely to notice or be disturbed by nausea, bloating, or other gastrointestinal symptoms. And the discomfort might still happen, but they're not awake to experience it as intensely. And so that's the reason why it's supposed to be taken at bedtime, right? Now, letter A is an incorrect option. This is incorrect because there is no need for routine kidney function testing before starting this medication. And the focus is usually more on cardiovascular and pulmonary health because donepezil can cause bradycardia, right? And also other heart-related issues. Now, kidney function might be monitored in some cases, but it is not a primary concern in this case. What about letter C? This is also a tricky one, right? We know that nausea and diarrhea can happen with donepezil, but they should never stop the medication on their own because discontinuing donepezil can, or if they are discontinuing the medication suddenly or abruptly, this can lead to worsening of cognitive symptoms. And if these side effects occur, the provider might adjust the dosage, or they might have some supportive care like anti-nausea medication to counteract the nausea. So always talk to the healthcare provider before making any changes. Letter D is also an incorrect option because this is a common misconception because acetaminophen is safe to use with donepezil. Well, the concern is actually with NSAIDs like ibuprofen, which can irritate the stomach and it can increase the risk of gastric bleeding. And that's why you should avoid taking this NSAID with donepezil. All right. So key takeaways here. The medication should be taken before bedtime to minimize gastrointestinal discomfort and to avoid daytime drowsiness. And remember, acetaminophen is generally safe to take with donepezil, not NSAIDs, which could be avoided due to the risk of GI issues. And also, kidney screening is not necessary before starting donepezil. However, patients should be screened for any cardiovascular or any respiratory issues. Let's have 55. A nurse is participating in a legally mandated psychiatric evaluation of a client with antisocial personality disorder. Which behaviors are commonly associated with this diagnosis? Select all that apply. A. Manipulating others to hand over their belongings. B. Showing significant distress in social settings. C. Becoming upset when personal space is disorganized. D. Holding strong beliefs in supernatural forces. And E. Refusing to accept responsibility for mistakes or failures. And so, when you are the nurse dealing with someone who has antisocial personality disorder, there are a couple of big behaviors to keep an eye out, okay? So for example, people with the antisocial personality disorder often manipulate others to get what they want. And so they're going to convince others to give up their belongings. And that is why A is one of the answers here, okay? All right, manipulating others to hand over their belongings. They don't feel much empathy for others, and often they don't care about the rights or feelings of those around them. So if someone is trying to get others to hand over their stuff, it's definitely a sign of antisocial personality disorder. Another here is letter E, refusing to accept responsibility for mistakes or failures. Because people with antisocial personality disorder rarely owns up to their actions. They're going to point the finger elsewhere to avoid facing consequences of what they have done. So it's a way for them to maintain control without feeling guilty. Now let's go into the incorrect options here. We have letters B, C, and D. Letter B, extreme anxiety in social settings is more of a sign of avoidant personality disorder. And people with avoidant personality disorder fear rejection. So they tend to avoid social interactions. But someone with antisocial personality disorder, they're usually fine in social situations. They may even take advantage of them. Now, letter C, another incorrect option, getting upset when things aren't neat is more about obsessive compulsive personality disorder. So people with OCPD are obsessed with order and perfection. Okay, while ASPD or antisocial personality disorder, they are more impulsive and reckless. What about letter D here? Holding strong beliefs in supernatural forces. This is more of a schizotypal personality disorder. So the person with a schizotypal personality disorder, they believe that they can control events with their thoughts. So people with the antisocial personality disorder are usually much more practical, and they are more focused on manipulating situations for their benefit. All right. So I want you to remember about this kind of personality disorder. Again, the biggest challenge is their manipulative and exploitative nature. So what you need to do to this patient is to set clear boundaries, avoid falling for deceptive tactics, and you have to maintain firm, structured interactions and make sure that you document behavior patterns to inform treatment plans.
If you're looking for a full, structured study plan that guarantees success, then this is just the beginning. You can enroll in our full-length NCLEX crash course. For the past 3 years, more than 10,000 students have successfully passed the NCLEX using this program. This isn't just another review course. It's built from real insights gathered from 5,000 registered nurses who have passed the NCLEX. We know exactly what it takes to succeed, and we've designed this course to give you everything you need to pass on your first attempt. Here's what you'll get inside. 300 plus hours of recorded video lectures covering all essential NCLEX topics in detail. 100 plus animated crash course lessons, making even complex topics easy to understand. 500 next generation NCLEX NGN questions so you can master the new exam format. 10,000 previously asked NCLEX practice questions, reinforcing your learning with real exam level difficulty. 30 full-length practice tests, helping you develop strong test-taking strategies. A comprehensive NCLEX ebook for in-depth review and quick reference. 1 year unlimited access, so you can study at your own pace without stress. This is your chance. Enrollment is open for a short time, and right now you can get in for 70% off. Enroll now and take control of your NCLEX prep. Visit website www.stancoastnclexcoaching.com. Link also in the description box. Now, let's dive into today's session and get started.
We have 56. A nurse is interacting with a client diagnosed with avoidant personality disorder. Which of the following statements is most characteristic of this condition? Options: A, hurting myself helps me cope with my emotions. B, I want everyone to admire and praise me. C, I fear that people will abandon me. And D, I'll attend group therapy, but only if I'm allowed to smoke. Now, when you're working with a client diagnosed with avoidant personality disorder, you'll notice that they often have a deep fear of rejection and abandonment. And that is why we have option C as the answer. So when they say, I fear that people will abandon me, it really captures the essence of this disorder, okay? So avoidant personality disorder is all about social inhibition and a constant feeling of inadequacy. So these clients might avoid social situations because they fear being judged or rejected. And even when they do engage, they worry that others might leave them. Now let's take a look into the other options, A, B, and D. Why letter A is incorrect? Because this sounds more like a person that you can, this is something that you can probably notice in a person with a borderline personality disorder, right? Take note that with people with the BPD or the borderline personality disorder, they often engage in self-harm as a way to deal with emotional pain or emptiness, which is different from the fears of rejection seen in avoidant personality disorder. Letter B is also incorrect. This is reflecting narcissistic personality disorder. Now, I want you to recall that people with narcissistic personality disorder, they have an exaggerated sense of their own importance and need constant admiration from others. On the other hand, we have the avoidant personality disorder. They avoid criticism or rejection, not seeking admiration. Lastly, we have letter D. This is also incorrect because this kind of manipulative behavior is more typical of someone with antisocial personality disorders. And remember, clients with antisocial personality disorder often show a disregard for others' need, and they might use manipulation to get what they want, which doesn't align with the fears of rejection found in avoidant personality disorder. And so I want you to remember that people with avoidant personality disorder desperately want to connect with others, but their fear of criticism and rejection holds them back. They avoid social situations, not out of disinterest, but because they assume they'll be judged or abandoned. Now, how can you help this client? Well, you got to be patient because socializing feels like stepping into a minefield for them. And you also need to offer reassurance, let them know they are accepted. And you also need to encourage small steps by gradually exposing them to social interactions to help them build confidence over time. In short, avoidant personality disorder is about fear, not manipulation or attention seeking. Alrighty, I hope you got those rationals. 57. A client with a prolonged history of alcohol dependence exhibits a particular behavior that suggests readiness for rehabilitation. Which observation indicates a willingness to seek help? Options: A, consuming alcohol only in social settings. B, abstaining from alcohol for 7 days. C, admission to a medical facility for withdrawal management. And D, expressing a sincere intention to recover. Well, no doubt about that. We have option D as our option. And so when a client admits they have a problem and if they express a desire to change, that is a clear indication that they're ready for treatment. And it shows they have self-awareness and they are also motivated to work on their recovery. So we have options A, B, and C as incorrect choices. So why is letter A incorrect? Consuming alcohol only in social settings. Well, this option does not demonstrate readiness for full recovery. If the person is still drinking in any setting, they're not fully committed to sobriety. Letter B is also incorrect, abstaining from alcohol for 7 days. Well, this is a good start, but it's too short of a time frame to show true readiness for rehabilitation. So the client here may be in the beginning stages, but needs more time and consistent effort. Letter C is also incorrect because just being in the hospital for detoxification does not necessarily mean the client is ready for rehab. And take note that some people go through detox but are not fully committed to the long-term recovery process. And so, test-taking tip for you here is to look for that option that reflects readiness, right? This is shown by verbal commitment to change. So if they're vocal about their intention to get better, that's actually a sign that they're truly ready. 58. The nursing team is discussing strategies to build rapport with a newly admitted client diagnosed with antisocial personality disorder. Which behavior trait should be considered when formulating a care plan? Options: A, engages in repetitive compulsive actions. B, prefers self-reliance over social connections. C, demonstrates an absence of concern for others' emotions. D, experiences challenges in expressing thoughts and feelings. Now, the answer here is letter C. And why is that? Because this demonstrates an absence of concern for others' emotion, right? And one of the most defining features of antisocial personality disorder is a lack of empathy. And remember, these clients often disregard others' feelings, which makes it challenging to form a meaningful connection. Now let's take a look into options A, B, and D. A first. So this would be more in line with obsessive compulsive disorder, not antisocial personality disorder. Letter B, prefers self-reliance over social connections. Well, in reality, people with antisocial personality disorder can be highly manipulative and rely on others to help them get what they want. And for D, another incorrect option, this is on the contrary, right? People with antisocial personality disorder can be charming and articulate when they want to be. So they usually know how to manipulate others through their words. And so for you to answer this question correctly, especially pointing out personality disorders, focus on the hallmark traits. Again, with antisocial personality disorder, there is going to be lack of empathy and also disregard for others' emotions. All right, don't forget that. Again, we are inviting you to enroll to the NCLEX course via stanclosNCLEXcoaching.com. Let's proceed. Number 59. A nurse is managing a client with depression who has started taking venlafaxine. Which of the following side effects should the nurse watch for with this medication? Select all that apply. Options. A, lightheadedness. B, low blood pressure. C, enlarged pupils. D, reduced interest in sexual activity. E, hair loss. Well, the answers here are options, letters A, C, and D. So what you need to pay attention here is all about the known side effects, especially those related to sexual health and autonomic nervous system effects, which are common in venlafaxine. And that's why lightheadedness is one, particularly when they are going to assume a standing position. And this is going to cause them orthostatic hypotension. So you, as a nurse, should educate the client to rise slowly from a sitting or lying position to prevent dizziness or fainting. Now, keep in mind that letter C, this medication, the venlafaxine, can cause pupil dilation, which is especially important for clients with glaucoma. Take note about that. The dilation of pupils can lead to vision disturbances, and this will require monitoring. Letter D, this is reduced interest in sexual activity or sexual dysfunction. This can include reduced libido, which is a common side effect of venlafaxine. And this is something that should be discussed with clients so they can report any significant changes and manage the side effect appropriately. Now, options letters B and E are incorrect. Now, let's take a look into low blood pressure. Well, venlafaxine is more likely to cause hypertension, not hypotension, especially if given at higher doses. So, it is very critical to monitor their blood pressure regularly, especially in clients with pre-existing hypertension. Letter E, hair loss. Well, alopecia is not a typical side effect of venlafaxine. This side effect is more commonly seen with other medications like chemotherapeutic drugs rather than antidepressants. Let's have number 60. A nurse is providing discharge instructions for a client who has a new prescription for clozapine. Which of the following statements should the nurse include in the instructions? Options: A, taking this medication long-term may cause tremors in your hands. B, you will need to monitor your white blood cell count weekly. C, it's important to have a high-carb snack between meals and at night. D, temporary numbness in your mouth may occur after each dose. You should select option B this time, because clozapine can cause serious adverse effect such as agranulocytosis, which can cause a severe drop in the white blood cells, and that means you'll be at a higher risk for infections, right? So it's critical to monitor the client's white blood cell count weekly to catch early on. Now, options letters A, C, and D are all incorrect. We know that letter A, it says here, taking this medication long-term may cause tremors in your hands. Yes, while taking clozapine can cause some side effects like drowsiness or dizziness, but tremors are more often linked to other antipsychotics. So this is not a common side effect of clozapine. Letter C, also an incorrect option, because clozapine can increase their risk of weight gain and also diabetes. So recommending a high carb snacks won't be a good idea. They need to stick into a balanced diet, right? Again, don't let them do the high carb intake and also in between meals. We have letter D, temporary numbness in your mouth may occur after each dose. This is actually a side effect of asenapine, not clozapine. So this is not something to expect with this specific medication. All right. Alrighty, let's have number 61. A nurse is caring for a client experiencing opioid withdrawal in a mental health facility who has been prescribed clonidine. What is the nurse's priority action? Options: A, offer the client ice chips to suck on. B, explain the effects of clonidine to the client. C, administer clonidine as prescribed. D, take the client's vital signs as a baseline. Your answer here should be letter D. The first step in the nursing process is assessment, right? So obtaining the vital signs is really critical to understanding the client's condition and also to establish a reference point to monitor the effects of clonidine, especially since clonidine can cause hypotension and also low heart rate. Letters A, B, and C are incorrect. Letter A, it states, offer the client ice chips to suck on. We know that this can help alleviate dry mouth, but it is not the priority action. We need to assess and we got to obtain the vital signs first, right? Letter B, another incorrect option, because educating the client is important, but this step comes after assessing the client's condition, okay? So I want you to recall that education is given once the client is stabilized. What about letter C, administer clonidine as prescribed? Well, we know that this is going to be important, but you are going to do the assessment first, get the baseline of your patient's vital signs before giving any antihypertensive medication to monitor for potential side effects. You need to get that number. 62. The family of a client with Alzheimer's disease wants to care for him at home, but is struggling with his tendency to wander. What advice should the nurse give to the family? Select all that apply. Options: A, have the client wear an identification bracelet. B, install alarms and high locks on doors. C, set up motion and sound detection systems. D, request a sleeping medication from the healthcare provider. And E, have a family member stay with the client overnight. Now, the options are letters A, B, and C. Okay, why letter A? Because the key concern here is wandering, which is common in Alzheimer's disease. So this should trigger you to consider interventions aimed at preventing wandering while maintaining the client's safety. Again, now we talked about safety, and since wandering can lead to falls, injuries, or getting lost, so you need to also prioritize interventions that can promote safety. Another is independence. The family here is trying to care for the client at home, so solutions that can allow some autonomy while maintaining safety should also be favored here. And you also need to eliminate those options that are either too burdensome or impractical for the caregivers, right? And you have to avoid medication-based intervention because the question mentions the family's struggle with wandering, but it doesn't imply that medication should be the first choice. So you need to always prioritize non-pharmacological intervention unless the situation specifically calls for a medication. Keep that in mind. We have options A here. That's wearing of an identification bracelet, install alarms, high lock doors, and we also have letter C, set up motion and sound detection system. Okay. Now, let's talk about letter C. Okay, so those motion and sound detectors alert the caregivers when the client is wandering, and this can allow them to intervene early. And so these systems can promote safety by detecting the movement or maybe sounds associated with wandering without resorting to overly restrictive measures. So this intervention is non-intrusive, and this can also provide a balance between safety and autonomy. Okay. We also have letter B, install alarms and high locks on doors. So the alarms can provide immediate alerts if the client attempts to leave the house, and this can allow the caregivers to respond quickly as well. And the high locks are effective because people with Alzheimer's may forget how to unlock them. And so these interventions can ensure safety without physically restraining the client or impeding their ability to move around. So our incorrect options here include letter D and letter E. So if you're requesting, or if you're selecting a request a sleeping medication, so this could probably pertain to benzos, hypnotics. These are not ideal for managing wandering, and these medications are known to worsen confusion. This can also increase the risk of falls, and they can have a lot of side effects like dizziness and also impaired coordination. And most of all, they also don't prevent wandering, which is the central concern here. So take a look into the non-pharmacological solutions, which are always preferred. What about letter E? Have a family member stay with a client overnight. This is incorrect because we know that constant supervision may seem like a good idea, but having a family member stay up all night is not realistic, and this could lead to caregiver burnout, and it's also unsustainable in the long run. Instead, you should look into interventions like alarms, locks, sensors that are more practical, and this can allow the caregivers to maintain their own well-being. Alrighty, 63. During a home visit to an older client with mild dementia, the client's daughter expresses concern that her mother sleeps throughout the day and stays up all night, making it difficult for her to sleep. What should the nurse suggest? Options: A. So this is basically going to be a select all that apply. I forgot to indicate there. All right, so option A, encourage the client to do simple exercises or take short walks when she feels sleepy during the day. B, ask the healthcare provider for a strong sedative. C, help the client relax before bed with a warm bath or soothing music. D, set a consistent daily schedule for waking, hygiene, meals, rest periods, and sleep. And lastly, suggest that the daughter offer caffeinated drinks to her mother during the day to help her stay awake. So let me just quickly fix this one. We are on slide 74. All right. Right. Okay, let's go back to the case. Alrighty, so what would be your answers here? These are going to be letters A, C, and D. All right. So that's going to involve simple exercises or take short walks when she feels sleepy during the day. So this can do wonders. So this can help keep the client more alert when they should be awake. And this can make it easier to sleep at night. While we have letter C, help the client relax before bed with a warm bath or soothing music. This can help the client unwind before bed. So also relaxation techniques can calm the mind and also prepare their body for rest. Letter D is also a good option because having a consistent routine for waking up, meals, hygiene, rest, and bedtime can help regulate the body's internal clock. And so this can also reduce bedtime drowsiness and can improve sleep quality at night. So we have incorrect options, letters B and E. It said here at B, ask the healthcare provider for a strong sedative. Now, I want you to be mindful about prescription sleep meds, right? These are not the best option for elderly clients. And their bodies process drugs differently, which can increase the risk of side effects like excessive drowsiness and falls. And so it's much better to focus on non-drug solutions first. Also in E, caffeine might help keep the client awake during the day, but it can backfire by making it harder to fall asleep at night. And take note that older adults are especially sensitive to the effects of caffeine, so it's best to limit or at least avoid it. All right. So I want you to focus on safe, non-pharmacological strategies for managing sleep disturbances in elderly clients, especially those with dementia. And as much as possible, avoid pharmacological options that may increase the risk of adverse effects, could be false, and choose for lifestyle and environmental modifications that can support healthy sleep patterns. 64. In addition to developing gradually over hours or days, what other key feature should the nurse consider when assessing delirium? Options: A, inability to recognize objects despite normal sensory function. B, severe memory loss that may be classified as amnesia. C, long-term impairment in social or work-related abilities. Lastly, D, cognitive and awareness disturbances that vary throughout the day. So when you are the nurse assessing a client for delirium, you need to focus on the key characteristics, how it develops and how it presents. Now, I want you to remember, delirium is a sudden, it is temporary, and fluctuating disturbance in mental status, and it's often seen in hospitalized or critically ill patients. The answer here is letter D, and this is one of the hallmark features of delirium. Okay, it waxes and wanes. It means that a client may appear confused in the morning, may seem fine at noon, then become disoriented again in the evening. So this is called fluctuating cognition, and it is a key difference between delirium and dementia. And the delirium often results from acute physiological imbalances such as metabolic disturbances. Maybe there is hypoxia or electrolyte imbalances, dehydration, or maybe hyponatremia, or maybe infections commonly seen in sepsis, or maybe pneumonia. And if there's probably neurotransmitter imbalances, especially in a deficiency in acetylcholine and maybe an excess in dopamine. And also keep in mind that delirium is reversible when the underlying cause is treated. So it does not cause the same permanent cognitive decline as dementia. And so The other options, letters A, B, and C, are incorrect. So letter A, this basically describes agnosia, which is a classic sign of dementia, particularly Alzheimer's disease. And clients with agnosia see an object perfectly fine, but cannot recognize or name it. And this occurs due to the damage in the temporal or parietal lobes of the brain, which is common in progressive neurodegenerative disorders. While delirium, on the other hand, this can affect attention and awareness rather than object recognition. Letter B is also incorrect. We know that delirium can cause some memory problems, but it does not lead to severe long-term memory loss like dementia does. Okay, and I want you to remember that delirium primarily affects short-term memory and attention. But once the underlying cause is treated, their memory typically comes back, or it will improve. And in contrast, dementia, especially in Alzheimer's disease, it involves permanent memory loss due to neurodegeneration and the accumulation of beta amyloid plaques and tau tangles in the brain. Letter C is also incorrect because long-term cognitive impairment is a defining feature of dementia, not delirium. And again, delirium is temporary and can resolve within days to weeks with proper treatment, while dementia is progressive, meaning it can worsen over time and gradually leading to permanent impairment. All right? So, when you answer this kind of question, I want you to look for time-related clues in the question, okay? So it stated that delirium develops gradually over hours or days. So this is basically a big hint that the correct answer should describe a symptom that is sudden and fluctuating rather than long-term. Okay, let's have number 65. A nurse is assisting a client diagnosed with borderline personality disorder. Which of the following strategies are suitable for managing clients with this condition? Select all that apply. A, offering emotional stability and predictability. B, encouraging immediate independence. C, supporting gradual emotional detachment and self-development. D, prescribing anti-anxiety medication. E, focusing on ensuring the client's safety. And F, assisting the client in expressing anger appropriately. You should select letters A, C, E, and F. Let's tackle first letter A. So, consistency is key when you're working with clients with borderline personality disorder because they often struggle with emotional regulation and they perceive relationships as unpredictable or unreliable. And so when you're maintaining a structured and a predictable environment, the nurse can help establish a sense of trust and security. Now, letter C is also correct because clients with borderline personality disorders may have intense fears of abandonment, and it makes emotional detachment difficult. However, it's also important to encourage independence gradually rather than pushing too fast. And I want you to remember this, that the goal is to help the client develop coping mechanisms so they can eventually rely on themselves instead of depending solely on others for emotional stability. Letter E is also a good answer. And one of the most significant concerns with BPD is self-harm and suicidal behavior. And these clients often experience extreme emotional distress, which can lead to impulsive self-injury. And your first priority is to ensure a safe environment and assess for any suicidal ideation or self-harming behaviors. We have letter F. We have clients with borderline personality disorders. They have trouble managing anger, and they may either lash out or maybe suppress it until it explodes. And so when you're teaching them healthy ways to express anger, like using I statements or engaging in therapeutic activities, this can be very beneficial. All right. Now, so if you have selected letters B and D, these are incorrect options. In B, encouraging immediate independence, this is a long-term goal and it's too soon. That can make the client feel abandoned, and so this can worsen their symptoms. So the process needs to be gradual and supportive. Letter D is also incorrect. We know that clients with BPD experience anxiety, but benzodiazepines are not typically the first line of treatment. These are only used in severe cases or emergencies, and the long-term use of benzos is highly discouraged due to the high risk of dependency. Okay, let's have number 66. A client with schizophrenia is prescribed clozapine, Clozaril. Which signs and symptoms may indicate an adverse reaction to this medication? Select all that apply. Options: A, elevated body temperature; B, drop in blood pressure when standing; C, sore throat; D, excessive thirst; E, increased urination; F, pill rolling movements. Your selection should be letters A, B, and C. Elevated body temperature, sore throat, and other flu-like symptoms are indicators of agranulocytosis, which is a serious adverse effect of clozapine. This requires immediate attention. Another is the drop in the blood pressure when standing. That's orthostatic hypotension in B. So this can cause dizziness, fainting, and this is a common side effect of the drug during the initial use of clozapine. And we have, of course, the C, sore throat, which I already mentioned. So your incorrect options are letters D, E, and F: excessive thirst, increased urination, pill rolling movements. Now, remember, pill rolling movements are extrapyramidal effects, more commonly linked to conventional or typical antipsychotics, but not atypical medications like clozapine. Now, I'm inviting you to enroll to the NCLEX course via stankosnclexcoaching.com. Let's proceed. 67. A psychologist admitted to a mental health facility has been challenging the authority of the treatment team, advising other clients against their care plans, and disrupting group therapy. What is the most appropriate nursing response? Options: A, instruct other clients to disregard the individual's remarks; B, avoid reacting to the behavior and allow it to diminish over time; C, limit interactions with other clients until the disruptive conduct stops; D, acknowledge the behavior and establish clear boundaries. The best answer here is letter D. Okay, this is about maintaining control while still respecting the client. So you acknowledge what's happening because ignoring it is not effective, and then you're going to set limits. And to keep in mind, boundaries are very critical in managing disruptive behaviors to ensure the environment stays safe and structured. So options A, B, and C are incorrect. We have letter A. Well, when instructing the other clients to disregard the individual's remarks could actually escalate the situation. It might make the disruptive client feel even more alienated or disrespected, and it doesn't really directly address the behavior at all. Now, letter B, avoid reacting to the behavior and allow it to diminish over time. This sounds passive, and we know that ignoring the behavior isn't going to make it go away. So if the behavior's left unchecked, it could lead to more disruptions. Letter C is also incorrect. Limiting interactions with other clients until disruptive conduct stops might seem like a reasonable option, but cutting communication without addressing the behavior directly could isolate the client even more, and this can potentially worsen the situation. And so when you are dealing with disruptive behaviors, you focus on controlling the environment. You have to acknowledge the behavior, but always set clear, consistent boundaries. It's about protecting everyone involved, not just letting things slide. 68. A nurse is assessing a client diagnosed with bipolar disorder currently experiencing a manic episode. Which findings are consistent with this condition? Options: A, passivity, B, dysphoria, C, anhedonia, D, inflated self-esteem, E, excessive speech, F, difficulty maintaining focus. Your answers should be, okay, wait a second. All right, so let's think first what happens during a manic episode. So this is when someone with a bipolar disorder is in an elevated, energetic state, so their behavior tends to be overly exaggerated. And so your answers here should be letters D, E, and F. Let's talk about letter D, okay? Inflated self-esteem. Okay, so the client here may feel grandiose, like they're invincible. And this is going to show up in how they talk about themselves. So they might believe they're capable of things that are way beyond reality, even leading them to take dangerous risks. So this is basically one of the key signs of mania, all right? Inflated self-esteem. There's grandiosity. Now, we also have letter E, excessive speech. This also makes sense. So when a client is manic, their thoughts race and they can't seem to stop talking. It's like they're trying to keep up with the thoughts running through their head, and so they talk rapidly or urgently, sometimes referred to as pressured speech. We also have letter F, difficulty maintaining focus. This is another big one. Take note that mania messes with their ability to concentrate because their brain is bouncing from one thought to thought, often jumping between topics. It's tough for them to focus on one thing for too long, which can make them distractible. Now we have the incorrect options, letters A, B, and C. With A, passivity, this is more of a sign of depression, not mania. And take note that people in a manic state are usually the opposite. They're hyperactive and constantly on the move. We also have letter B, dysphoria. This is a feeling of unease or dissatisfaction, which is a depressive symptom, not something that you'd expect in a person with mania. We also have letter C, anhedonia, which is the inability to experience pleasure, also goes hand in hand with depression. And take note that mania tends to bring on an overabundance of energy and excitement, but not a lack of enjoyment. So I want you to keep this in mind, that in manic states, think about behaviors that are exaggerated, impulsive, or hyperactive, and this can help you point you to the correct answers. Okay, remember that mania usually involves grandiosity, speech that they can keep up with racing thoughts, and a total lack of focus. 69. A client who attempted self-harm by cutting their wrists has been admitted to a psychiatric unit from the emergency department. Which nursing interventions should be implemented upon arrival? Select all that apply. Options: A, check and record vital signs. B, evaluate for ongoing suicidal thoughts. C, initiate constant supervision. D, establish a supportive therapeutic connection. E, assess wound dressings for any signs of bleeding. The answers, we have all of them: A, B, C, D, and E. All right. So letter A, this is checking and recording vital signs. And letter E, assessing wound dressings for any signs of bleeding. These are essentials in any situation wherein there is self-harm that has already occurred. And this ensures the client is physically stable, and managing any immediate medical concerns like bleeding is also a top priority. Now let's get into letter B, evaluate for ongoing suicidal thoughts. This is also correct. Given the risk of self-harm, we need to evaluate whether the client is still experiencing suicidal thoughts and keep a close watch on them. So constant supervision can prevent further harm. We also have letter D, establish a supportive therapeutic connection. Okay, so building trust with the client is very critical in helping them recover emotionally and feel safe in their environment. So this relationship can foster future interventions and also support their healing process. Alrighty, let's have number 70. A nurse is speaking with a client diagnosed with a phobia. Which treatment method has shown the greatest effectiveness? Options. A, therapy aimed at uncovering the source of the fear. B, gradual exposure combined with relaxation techniques. C, counseling, focus on altering disorganized thought patterns. D, psychoanalysis to address unresolved conflicts from earlier stages of life. Your answer should be letter B. Okay. Gradual exposure combined with relaxation techniques. This is the most effective treatment for phobias. And recall that phobias often involve intense fear of certain objects or situations. And when we gradually expose the client to the feared object or situation in a controlled step-by-step way, this is what we call desensitization. This will help desensitize their responses to the fear. And pairing this with the relaxation techniques can help them manage their anxiety, and which will also reduce the emotional and physiological reaction to the feared object. And over time, they can become less anxious about the phobia. So options A, C, and D are incorrect. Let's take a look into letter A. Therapy aimed at uncovering the source of the fear. This might seem logical, but insight into the cause of the fear doesn't necessarily help the client cope with the fear itself. Take note that phobias are often irrational, and just understanding the origin does not resolve the overwhelming fear. Also, letter C, an incorrect option. Counseling is focused on altering disorganized thoughts patterns, but doesn't really apply to phobias because phobias don't stem from disorganized thinking. This statement approach would be more relevant to disorders like schizophrenia or other psychotic disorders, but not phobias. Letter D is also incorrect. I want you to remember psychoanalysis to address unresolved conflicts from earlier stages of life could help with self-awareness, but it would not directly reduce the client's fear. And the therapeutic goal in phobia treatment is to actively work with the fear response rather than just uncovering past emotional conflicts. And so for you to answer this question correctly, you need to focus on treatment modalities that target the core symptoms of the disorder. And with phobias, it's usually about behavior modification, not just gaining insight into the source of the fear. 71. A client with dementia who has been cared for at home by their spouse for 5 years has recently developed aggression, agitation, and urinary and fecal incontinence. What should be the priority focus of care during hospitalization in a mental health facility? Options. A, addressing and managing behavioral disturbances. B, slowing down further cognitive and functional decline. C, prioritizing support for the spouse's well-being. D, implementing a structured toileting schedule. Well, this scenario describes a client with progressive dementia who has developed aggressive behaviors and worsening incontinence. And so, this actually signals the disease is in progression, which is common in moderate to severe dementia. And the priority in a hospital setting is to ensure the client's safety and behavior management. And so the answer here would be letter A. Okay? This is the most immediate concern is the client's aggression and agitation, because these can lead to self-harm. They can also harm others or maybe the caregiver. And this can also lead to caregiver burnout. Now, the hospital staff should implement strategies such as creating a calm environment, also using redirection techniques, and possibly administering medications if necessary. Now, why other options are incorrect, such as B, C, and D? If we are to look at B, slowing down further cognitive and functional decline, while it is important to slow cognitive decline, there is no cure for dementia at this stage. And so medications like donepezil or memantine may help, but they are not the priority when aggression is present. Let's take a look into letter C. Okay, so prior to with this caregiver support, this is very critical. But during hospitalization, the focus must be on the patient's immediate needs rather than the spouse's stress levels. Also in letter D, another incorrect option, this incontinence is very common in dementia, but it is a secondary issue compared to aggression and agitation. The client's behavior must be managed first before addressing toileting concerns. Now, when a question asks about priorities, always consider Maslow's hierarchy of needs and safety first. Okay? So, behavioral disturbances in dementia increase fall risk and injury. So, they take precedence over cognitive decline or caregiver burden. So, you got to look at the setting. This is a mental health facility. So, behavioral management should be a key focus. Okay? And my tip for you is that with the statement immediate safety concerns, this should always take priority over chronic disease management or caregiver support. Let's have number 72. A nurse in the ED is caring for a client experiencing benzodiazepine overdose. What should be the priority nursing action? Options: A, administer intravenous fluids. B, prepare for gastric lavage if necessary. C, give flumazenil as an antidote. D, assess the client's mental status and orientation. Now, because if you are in the ER and a patient comes in with benzodiazepine overdose, you need to think fast and prioritize correctly. And so your answer here should be letter D. And why is that? Now, before you jump into any interventions, you should always need to assess the patient first. This is the foundation of the nursing process, right? And so when somebody has benzodiazepine toxicity, remember that the central nervous system takes a hit. This can cause sedation, confusion, there's going to be respiratory depression, or even coma, and depending on how severe the overdose is. Now, when checking the patient's level of orientation is your option here, this is very crucial because it will give you an idea into the client's neurological status. This can help you determine how serious the toxicity and whether immediate action, maybe airway protection, or let's say giving an antidote is needed, right? So always do the assessment first. And the biggest concern with benzodiazepine toxicity is airway protection. Now, if mental status is altered, you need to act fast to prevent dangerous complications such as aspiration or respiratory failure. Now, we have letters A, B, and C as incorrect options. So letter A, administer intravenous fluids. Sure, we know that this can help, right? But benzodiazepines don't usually cause major blood pressure issues unless they were mixed with something else like alcohol or opioids. And The bigger issue is central nervous system depression, not hypotension. So fluids aren't your first move here. Letter B is also incorrect. Prepare for gastric lavage if necessary. All right, so this is what we call as stomach pumping. This is a method to remove ingested toxins from the stomach. However, this is only effective within 1 hour of ingestion and is rarely used for benzo overdose because the benzodiazepines are absorbed very quickly. So by the time a client shows toxicity symptoms, it's already too late for gastric lavage to help. Plus, if the client is too sedated, lavage could make things worse by causing aspiration, which is going to lead to aspiration pneumonia, right? Now, what about letter C? Give flumazenil as an antidote. Well, this is known antidote for benzo, right? But this is a bit tricky here. So if the client is a chronic benzo user, flumazenil could trigger withdrawal symptoms or withdrawal seizures, right? So you never just give an antidote without first checking the client's neurological status and deciding if they actually need it. So the priority in benzodiazepine toxicity is to assess first the client's mental status to determine the severity of central nervous system depression to help you guide with your interventions. Okay, so this could probably be next airway support and antidote or supportive care. So start with the assessment first thing. Let's have number 73. A nurse is providing education to a client prescribed alprazolam for generalized anxiety disorder. Which information should be included? Options. A. This medication has a lower likelihood of dependence than other anxiolytics. B. Drinking alcohol while taking alprazolam may cause an unexpected reaction. C. Report signs of confusion, as this may indicate toxicity. And D. It takes between 3 to 6 weeks for full therapeutic effects to occur. The answer here is letter C. Alprazolam is a benzodiazepine and it works by boosting the effects of the gamma aminobutyric acid or GABA in the brain, which can calm things down. But if they take too much of the benzo, it can lead to central nervous depression, central nervous system depression, which is a fancy way of saying that it slows down the brain and body too much. And so confusion is one of the first signs that things are going too far. And if it's not addressed, it can get serious. Things like respiratory depression, muscle weakness, and even coma. And so clients need to watch out for confusion and get help right away. What about letters A, B, and D? Let's take a look into letter A. This medication has a lower likelihood of dependence than anxiolytic. Nope, this is not true. Alprazolam has a pretty high risk for dependence, especially if it's used for a long time. And I want you to remember that alprazolam is classified as Schedule 4. It's a controlled substance, meaning it has a potential for abuse and addiction. We know that it works fast and can help with anxiety, but clients need to be cautious about using it for long term. Okay. Letter B, drinking alcohol while taking alprazolam may cause an unexpected reaction. This is also misleading, inaccurate. When the client mixes alcohol with alprazolam, it doesn't cause a paradoxical reaction. What can happen actually is when there are two central nervous system depressants working together, this can increase sedation, respiratory depression, making the situation much worse. So it's very crucial for clients to avoid alcohol entirely while they are taking alprazolam. Letter D, it takes between 3 to 6 weeks for full therapeutic effects to occur. This could be true, if we are talking about buspirone, which takes a while to kick in. But alprazolam works quickly in about 30 to 60 minutes. So it's great for fast relief of anxiety, but it doesn't need weeks to show results. So if you're going to encounter questions like this, you got to focus on the action and the risk of the medication itself. Again, alprazolam is a fast-acting benzo, but it has a higher risk of dependence and needs to be used carefully. So you got to keep an eye out for those answers that talk about side effects or signs of overdose, since those are key in managing benzodiazepine use. And you have to eliminate those options that don't align with the known pharmacokinetics or side effects of the drug. So for instance, anything that suggests a long onset of action, like 3 to 6 weeks for alprazolam, this is totally wrong. Because it works pretty quickly. And also remember the importance of safety when it comes to medications that affect the central nervous system, especially if mixed with things like alcohol. 74. A nurse is developing a care plan for a client undergoing withdrawal from benzodiazepines. Which nursing action should be prioritized? Options: A, provide adequate hydration and nutritious meals as tolerated. B, encourage involvement in support group discussions. C, regularly remind the client of their location, time, and identity. And D, establish seizure precautions. The correct option here is letter D. You need to do seizure precautions right now, at this moment. Why? It's because one of the most dangerous complications of benzo withdrawal is seizures. This is life-threatening, especially if the person has been using high doses for a long time. Now, I want you to recall about the action of the benzos. The benzos work by enhancing the brain's gamma aminobutyric acid, which is the main inhibitory neurotransmitter. Now, over time, with the long-term use of benzos, the brain downregulates its GABA receptors. And so when the medication is stopped, there's less GABA activity and an increase in excitatory neurotransmissions like glutamate and norepinephrine. So this creates a higher risk of seizures because the brain becomes more excitable. And so when we're talking about establishing seizure precautions, we are talking about padding the bed rails to prevent injury, keeping suction and oxygen equipment on hand, and also regularly monitoring the client's neurological status. And also think that you may also administer benzodiazepine taper to gradually reduce the drug and minimize withdrawal symptoms, including seizures. And again, the priority is making sure that seizures don't happen because they can lead to status epilepticus, which is much more life-threatening. And so options letters A, B, and C are all incorrect. And so if you selected letter A, provide adequate hydration and nutritious meals as tolerated, yes, this is good, right? Keeping the client hydrated and well-nourished is important. But dehydration and poor nutrition are not as immediately life-threatening compared to the seizures that can occur as a result to the withdrawal, right? What about letter B? Encourage involvement in support group discussions. This is also valuable for the long-term recovery process, especially in overcoming the psychological dependence on benzos, but it's not going to help in the acute phase when the risk of seizures is very high. So this is more of a secondary concern after immediate withdrawal symptoms stabilize. Letter C is also incorrect because benzodiazepine can cause confusion. There's also agitation, hallucinations, especially in severe cases, right? And so frequent orientation can help, but it does not address the immediate risk of seizures, which pose a greater danger, all right? We know that reorientation is beneficial for cognitive symptoms, but it does not prevent a life-threatening complication like seizures. always think about the safety of your patient as a result to the withdrawal, which is going to lead to that seizure episode. So when you're looking into this question, you focus on the most immediate and life-threatening risk. And take note that seizures are a very clear and a present danger in benzo withdrawal. So you should always prioritize this. And after you rule out the most urgent option, you can consider the others. And if it's not life-threatening or doesn't directly address immediate symptoms, it's likely a lower priority. And you need to keep in mind that you need to prevent acute complications first. Again, always prevent acute complications first. Those that are life-threatening, like seizures, before focusing on supportive measures like nutrition therapy or orientation. 75. A patient is experiencing drowsiness, hearing voices, an intense urge to move, and a lack of pleasure in daily activities. The provider has prescribed haloperidol, Haldol 5 milligrams 3 times a day, and trihexyphenidyl artane 4 milligrams twice daily. Which statement about these medications is correct? Options. A. The trihexyphenidyl artane would counteract the akathisia. B. The haloperidol Haldol would increase the amount of sedation exhibited. C. The haloperidol Haldol would address the anhedonia. D. The trihexyphenidyl artane would address the client's auditory hallucinations. The answer here is letter A. And here's why. Akathisia is that uncomfortable feeling of restlessness, like you just have to keep moving. It's actually a known side effect or adverse effect of antipsychotic medications like Haldol. Now, to counteract that restlessness, doctors often prescribe artane, which is an anticholinergic drug. So it helps by relaxing the muscles and reducing that constant urge to move. So in this case, trihexyphenidyl is the best choice to address the akathisia. Letter B, C, and D are all incorrect. Now let's take a look into letter B specifically. Well, some people might assume that Haldol can help with drowsiness, but that's actually the opposite of what happens. Haldol itself can cause sedation. So if the patient is feeling excessively tired, reducing or maybe switching to another medication would be more appropriate as ordered, right? Letter C is also incorrect. Haloperidol is great for tackling positive symptoms of schizophrenia, things like hallucinations and delusions. But when it comes to negative symptoms like anhedonia, which is the inability to experience pleasure, it doesn't do much. And that is why this option isn't the right choice. Letter D is also incorrect. This is a common trap. Some might think that trihexyphenidyl can help with hallucination, but it actually doesn't. Hallucinations are treated with antipsychotic medications such as Haldol, not with trihexyphenidyl, which is meant for managing the Haldol's side effects. And so when you're going to approach this type of question, you have to go into the different choices. Ask each option like a true or false type of question, meaning you have to check the accuracy of each statement. And the key here is knowing what each medication is actually used for. Again, Haldol treats the psychotic symptoms, hallucinations, delusion, whereas the trihexyphenidyl or artane manages the side effects like akathisia, right? So you have to watch for the distractors. Now, anticholinergic medications like trihexyphenidyl don't treat hallucinations, and sedating medications such as Haldol does not reduce drowsiness. So I want you to really review on pharmacology on this test question. So again, you are invited to enroll to the NCLEX course via Stanco's NCLEXcoaching.com, and you just knocked out 75 NCLEX questions. So awesome job for you. And remember that for every question that you have completed, this can really sharpen your critical thinking skills, and this can also enhance your confidence. So I want you to keep going in your independent review. You got to stay focused, you trust your preparation, and you got to believe in yourself. So thank you again. I'll see you in the next series.